morning and welcome to the 9th meeting of the Health, Social Care and Sport Committee in 2026. I've received no apologies for this meeting. Our first and only agenda item today is consideration of the non-surgical procedures and functions of medical reviewers Scotland Bill at Stage 2. I'll briefly explain the procedure we will be following during today's proceedings for anyone watching. Members should have with them a copy of the bill, the marshalled list and the groupings. These documents are available on the Bill webpage on the Scottish Parliament's website for anyone observing. I will call each amendment individually in the order of the marshalled list, and the member who lodged the amendment should either move it or say not moved when it's called. If that member does not move it, any other member present may do so. The groupings document sets out the amendments in the order in which they will be debated, and there will be one debate on each group of amendments. In each debate, I will call the member who lodged the first amendment in the group to move and speak to that amendment and to speak to all other amendments in the group. I will then call other members with amendments in the group to speak to but not to move their amendments and to speak to other amendments in the group if they wish. I will then call any other members who wish to speak in the debate. Members wishing to speak should indicate that by catching mine or the clerk's attention, and I will then call the member in charge if they've not already spoken in the debate. Finally, I will call the member who have moved the first amendment in the group to wind up and either press the amendment or seek to withdraw it. If the amendment is pressed, I will put the question on the amendment. If a member seeks to withdraw an amendment after it has been moved and debated, I will ask whether any member objects. If there is an objection, I will immediately put the question on the amendment. Later amendments in a group will not be debated again when they are reached. If they are moved, I will put the question on them straight away. If there is a division, only committee members are entitled to vote. Voting is by a show of hands, and it's important that members keep their hands raised clearly until the clerk has recorded their names. If there is a tie, I must exercise a casting vote. The committee is also required to consider and decide on each section and schedule of the bill and the long title, and I will put the question on each of these provisions at the appropriate point. At introduction, the presiding officer determined that a financial resolution was not required for the bill under Rule 9.12.6c. The presiding officer has determined that the costs associated with Amendment 105 would exceed the current threshold for a bill to require a financial resolution. Therefore, in terms of Stage 2 proceedings, Amendment 105 may be debated but may not be agreed to in the absence of a financial resolution. The presiding officer has also ruled that Amendments 36, 37, 50, 52, 54, 93, 94, 98, 99, 100, 104, 28, 106, 59, 107, 108, 109, 110, 111 and 35 are cost-bearing amendments. However, the potential cumulative cost of the amendments would not require a financial resolution. As such, those amendments and any amendments that would be consequential on those amendments will be debated and the questions will be put on the amendments as normal at Stage 2. I call Amendment 5 in the name of the Minister, grouped with Amendments 28, 30 and 34. Minister to move Amendment 5 and speak to all amendments in the group.
Thank you, Convener. As this is the first group considered today, I will make some quick general comments. My thanks to committee members for consideration to date. This is a complex bill and I'm grateful for your diligence in considering issues. Today I will be moving or supporting amendments that strengthen or clarify the bill without changing its fundamental character or the balance it must strike, protecting public safety without disrupting healthcare or causing unnecessary disruption to business. I'm grateful to members who've lodged amendments. We are all committed to improving public safety. Some amendments seek to address concerns about the impact of this bill on business, especially rural, small and female-led ones. Where I will be opposing these amendments, I want to be clear that I understand the place they are coming from. I will address why in relevant groups. Amendments 5, 28, 30 and 34 provide a way forward to allow Scottish ministers to establish training and qualification standards for practitioners working within the constraints of the UK Internal Market Act, UKIMA. I shared our understanding of the effect of UKIMA with this committee through the correspondence I directed to UK ministers. I have not yet received a response. Part 3 of UKIMA establishes an automatic recognition principle where a professional qualified in one part of the UK is automatically treated as qualified in another part of the UK. The effects of Part 3 of UKIMA mean that the Scottish Government is currently unable to set standards for qualifications or experience for individuals providing non-surgical procedures in the bill in the way we would like. Section 28 of UKIMA does provide a partial remedy to this. The individual assessment process under this provision would allow someone to have their existing training or qualifications assessed where different to those specified, to ensure they are equivalent to or meet the standards we established for Scotland. We still need to work with the UK Government on a long-term solution, as this is a cumbersome one. Nevertheless, I want to take the option available to allow us to progress with setting standards by following this route. We are pressing the UK Government for the issues with UKIMA to be resolved by repealing the Act and replacing it with a more equitable, co-designed system built around the Common Frameworks approach. I know many members are pushing for training and supervision standards. To them I say that this is a necessary first step. I urge members to support Amendments 5, 28, 30 and 34. I move Amendment 5.
Thank you, Minister. No other member has indicated that they wish to speak to this amendment. Can the Minister wind up?
I urge members to support Amendments 5, 28, 30 and 34 in my name. The amendments are necessary to meet the ambition to set training standards in the future.
Thank you, Minister. The question is that Amendment 5 be agreed to. Are we all agreed? Yes. The amendment is agreed. I call Amendment 6 in the name of the Minister, grouped with amendments as shown in the groupings. Minister to move Amendment 6 and to speak to all amendments in the group.
Thank you. I am pleased to open this group, which includes amendments on several issues related to the fundamental definition of a non-surgical procedure. I will start by considering those amendments that relate to the healthcare exception provided by Section 1 of the Bill. We have been clear throughout this process that this bill is not designed to regulate, restrict or interfere with the delivery of healthcare in any setting. The bill achieves that by providing that any procedure which is undertaken for or under the direction of a healthcare professional is not a non-surgical procedure. There should, for example, be no offence committed if a treatment for a healthcare purpose by a regulated healthcare professional is given to a child. As well as not interfering with healthcare delivery, we also want to ensure that we do not inadvertently capture procedures carried out as part of clinical trials under the Bill's provisions, which are already regulated elsewhere. Amendment 6 in my name will make it clear that procedures that are carried out as part of a clinical trial within the meaning given by Regulation 2.1 of the Medicines for Human Use Clinical Trials Regulations 2004 will not be covered by the provisions of the Bill. This is required because certain procedures undertaken as part of such trials may not be covered by the existing healthcare exception in Section 1(1)(b) of the Bill. In a clinical trial, a person who has no illness may receive a procedure, for example, if possible side effects are being investigated. Amendments 7 and 8 are technical amendments, correcting and clarifying references to the licensing of non-surgical procedures under the Civic Government Scotland Act 1982. I hope these are uncontroversial amendments. Also relating to healthcare exception are Sandesh Gulhani's Amendments 64 and 65. These amendments would remove the General Osteopathic Council and the General Chiropractic Council from the list of healthcare professionals who can undertake or direct procedures that would be considered exempt from the bill. This is an issue that Dr Gulhani has raised in previous sessions, and I'm happy to reiterate some of my comments for the record today. This bill is not the place to judge what does and does not constitute healthcare, nor whether particular healthcare procedures are appropriate or effective in the treatment of disease. I can, however, inform the committee that both chiropractors and osteopaths use injections of hyaluronic acid as part of their practice. I understand that the committee has received correspondence on this matter. Whether this is effective or appropriate is between those professionals and their regulators. I know that some committee members are concerned that the healthcare exception is essentially a loophole, so wish to offer some reassurance on that point. In order to fall under the healthcare exception, a regulated healthcare professional carrying out a procedure regulated by this bill must have a healthcare purpose. And if a prosecution was brought against an individual, the presence of such a healthcare purpose is something that may be considered by the courts, and such bad faith activity is likely to lead to professional consequences as well. Finally, the Scottish Government considers that Amendments 64 and 65 may raise concerns about the interaction of these amendments with the reservation of the Regulation of Health Professionals in Scotland Act 1998. For these reasons, I urge Dr Gulhani not to press these amendments, but I'm happy to hear any views he may have on this matter. I will now turn to the amendments that relate to the power in Section 1(5) to modify Schedule 1. I would like to remind members that Amendment 35 in my name, to be debated as part of Group 7, would impose a consultation requirement on all exercises of affirmative powers in the bill, including the power to modify Schedule 1. I trust this amendment will be supported as it addresses the recommendations made by the Delegated Powers and Law Reform Committee at Stage 1. In the scenario where an entirely new procedure emerges, I believe it is best that ministers can move fast and regulate those procedures quickly. If the advice we receive is that such a procedure has a risk profile equivalent to procedures already included in the bill, then I think it is reasonable that members have scope to list such a procedure in Schedule 1 on the best evidence available at the time, and this consideration would naturally form part of a policy note and any impact assessments. Amendments 36 and 37 would add to this and make the exercise of this regulation-making power harder, preventing the Scottish ministers from acting quickly when required. In return, this will have public safety considerations and a negative impact for potential clients and practitioners alike. For these reasons, I ask Jeremy Balfour and Maurice Golden not to press the amendments in their name. I now turn to amendments in Schedule 1. The amendments in my name, 10 to 21, make several important changes, largely of a technical nature, or where the effect of the schedule will be unchanged from its original intent. Amendments 10 and 16 remove the paragraph for cellulite subcision and inserts a new one headed subcision. The text and effect is unchanged, but the amendment reflects that subcision can be used for other purposes, such as improving the appearance of pitted scars. Amendments 11, 12 and 21 amend the Schedule 1 entries for injectable or intravenous non-surgical procedures to limit these only to those provided for a cosmetic or well-being purpose. A cosmetic purpose relates to a person's appearance. A well-being purpose is one that provides an actual or perceived improvement in the person's physical, mental or emotional well-being, physical strength or stamina, ability to concentrate or mental alertness. This provides additional clarity, but continues to deliver the intent of our bill regulating procedures undertaken for these reasons, but prevents any procedures or activities carried out for other purposes from being inadvertently captured. Amendments 18 and 19 in my name amend the definition of a substance to make clear that controlled drugs and psychoactive substances are not included. These are not used in non-surgical procedures, and so it is appropriate to exclude them from the definition of a substance. Amendments 13 and 17, also in my name, address the boundaries between the Schedule and Schedule 1 of the Civic Government Scotland Act 1982, Licensing of Non-Surgical Procedures Order 2026. The SSI introduces a local authority licensing scheme which regulates lower risk non-surgical procedures. A procedure, even if it would otherwise be low risk, becomes higher risk where a prescribed anaesthetic is used or where it is carried out on an intimate area. With the exception of intimate laser hair removal, these procedures are excluded from the SSI. Amendments 13 and 17 provide that these procedures are regulated by the bill instead. These procedures carry additional risks, which are better managed in a permitted premises where there will be healthcare professional involvement. Amendment 14 and 15 clarify the definitions of microneedling to ensure that a procedure that involves an injection or intravenous administration of a substance is captured by the relevant paragraphs, not this one. It provides that microneedling will include the use of one or more microneedles multiple times on a single occasion. This helps avoid confusion with other procedures which may also use a fine needle. Amendment 14 also provides that where microneedling, no matter what the depth, is used to deliver radio frequency electromagnetic radiation, it is a procedure regulated by the Bill. This is considered a riskier procedure which carries increased risk of harm, including burns, excessive scarring and damage to nerves and blood vessels. Procedures covered by the Local Authority Licensing Scheme under the Civic Government Scotland Act 1982, Licensing of Skin Piercing and Tattooing Order 2006, which extends to acupuncture, cosmetic body piercing, electrolysis and tattooing, provided in the course of a business already exempted from the Bill by virtue of Section 11B3. However, Amendment 15 ensures that these procedures are also accepted when they are carried out in circumstances which would not require a licence under the 2006 order, for example, when not carried out as part of a business in someone's home. It was never the intention of this bill to regulate these procedures, which did not form any part of the consultation process. Having covered the amendments in my name relevant to Schedule 1, I would now like to turn to the amendments 38 and 39 lodged by Maurice Golden, which relate to procedures such as skin boosters and mesotherapy. Mr Golden has made the case, which I have also heard, that these procedures carry less risk than other procedures considered in Schedule 1. I should be clear that this is not universally accepted, and I'm sure Mr Golden would accept that this does not mean that these procedures are risk-free. Any introduction of a substance into the body carries some risk. The substances used in these procedures are wide-ranging, which makes that risk hard to assess. I have also heard the concern that these procedures, especially skin boosters, use similar products and similar, if not the same, needles and other equipment as procedures such as dermal fillers. If this amendment is successful, there is a risk that it will make the work of local authority officers much harder in ensuring that licensed premises are only carrying out the procedures they are entitled to. It has been my guiding principle that procedures should only be included in the bill where this is absolutely necessary to protect public safety. And I will be happy to discuss these changes further at stage 3 with members and Mr Golden. I urge members to support amendments 6 to 8 and 10 to 21. I repeat my willingness to work with Mr Golden and on that basis, ask him not to press the amendments until we have discussed at stage 3, and also ask Jeremy Balfour and Sandish Gulhani not to press the other amendments in this group. I move Amendment 6.
Thank you, Minister. Sandish Gulhani to speak to Amendment 64 and other amendments in the group.
Thank you. Declaration of interest of practising NHS GP. I suppose Amendment 6 is the one that I'd like to start with, and I'd like to directly ask the Minister about this, because I do support the idea of clinical trials not being part of this, and it's, the amendment makes sense. My only question about it is ensuring that they are indeed real clinical trials, not one that somebody says is a clinical trial. So maybe something in there about it having gone through the ethics committee, or something to just strengthen to make sure that it is a clinical trial that has been agreed by an ethics committee to say that it is acceptable. Not to say that I wouldn't support it, but I would like to see a tweak made when we come to stage 3. Turning to 64. Now, the Minister spoke about how this is not the place to debate what does and does not constitute medicine. But the point that I would like to make is that there is no reason why an osteopath should inject somebody. That's simply not part of the job of being an osteopath. Whether we agree that osteopaths have any place within science and medicine can be debated possibly at stage 3 later, but there is no reason for an osteopath to be injecting anybody, and osteopaths are unable to prescribe medicines. And for that reason, I do not see why osteopath should form part of this bill. Chiropractors is different because chiropractors have a lot of work that they do within the NHS, and I do feel that given that there is hydrochloric acid that is being injected, that possibly it's one that I might bring back at stage 3 and I might not be pressing that one. As for Maurice Golden and Jeremy Balfour's amendments, I do support the principle behind the idea of ensuring that there is some reasoning given for why something is added. But what I don't want to see is a huge amount of extra work required to do that, which would potentially slow down new procedures being brought into this bill or make it cumbersome and too difficult to do. So it's the principle I support, but I think this does need work to come back at stage 3.
Thank you, Mr Gohani. Maurice Golden to speak to Amendment 36 and other amendments in the group.
Thank you, Convener. And prior to speaking to my amendments, I would just like to say that as a result of an article appearing in a national newspaper today, I believe I should put on the record that my girlfriend currently works in the aesthetics sector. I think that private lives should remain as such, and I have no financial links to the sector and happy to speak privately to members following this session. In terms of my amendments in this group, Amendment 36 is intended to prevent the expansion of scope without evidence, enforceability, assessment and consultation. And Amendments 38 and 39 make the case, as the Minister has highlighted, that there is less risk with these procedures. However, I do accept the Minister's argument that these are not risk-free, and my intention would be to not move amendments at stage 2.
Thank you, Mr Golden. Jeremy Balfour to speak to Amendment 37 and other amendments in the group.
Thank you, Convener. Good morning, Committee, and good morning to Minister and her team. The amendments I bring forward this morning really come out of, firstly, discussions with a number of constituents who have raised concerns with me in regard to this bill, and also a number of emails and meetings with the Federation of Small Business, who again have expressed some concerns around where this bill is at the moment. Amendment 37 requires Scottish ministers, before having any new procedures in Schedule 1, to carry out a formal risk assessment and consult representatives of the beauty and aesthetic sector, small businesses and other relevant stakeholders. Whenever we introduce something that will change, I think it is important that we get the balance right between ministers being able to act quickly, but also the appropriate consultation taking place. The amendment introduces a clear safeguard into the bill, ensuring that any future expansion of the regulatory regime is preceded by proper evidence gathering and meaningful engagement with those affected. And again, this will stop maybe a certain group or a certain lobby being able to go ahead without the proper consultation. And it also protects the bill, as it will be here for hopefully a number of years, that ministers themselves do not go down perhaps alleys that the rest don't agree with. The amendment does not remove or limit ministers' ability to amend Schedule 1. Instead, it ensures that their power is exercised through a defined and transparent process. Decisions to bring additional procedures within scope would need to be supported by an assessment of safety risks, consumer protection, concerns and economic impact, and informed by reviews of practitioners, businesses who would be directly affected by any change. The regulation of non-surgical procedures is, I think we all agree, a fast-moving area. New treatments and techniques are introduced regularly, and the public concern about safety continues to evolve. It is likely, therefore, that over time there will be proposals to expand the list of regulated procedures. While it's important that ministers can respond to emerging risks, it is equally important that any expansion is proportionate and based on clear evidence of harm. When perhaps the Minister is summing up, at the moment I don't see any role for others to be able to put their concerns in regard to anything that is brought forward, and where is there any consultation with those that are carrying out the work. The sector is made up largely of small and micro businesses, many operating with limited administrative resources and tight margins. Regulatory changes can therefore have a significant financial and operational impact. Even well-intentioned reforms may lead to higher compliance costs, service restrictions or unintended barriers to enter. This amendment seeks to ensure that future decisions take account not only of safety, but also practical delivery, workforce implications and economic sustainability. It embeds transparency, accountability and evidence-based decision-making into the operation of the bill. In doing so, it supports an approach that is responsive to risk, but is measured and helps the sector to respond in a predictable way. If agreed, ministers, as I've said, will retain the ability to add new procedures where justified. However, that power will be exercised within a clear, accountable framework. Businesses and practitioners will have greater confidence that changes will not be introduced without proper scrutiny and consultation. The quality of future regulatory decisions is also likely to improve as stakeholder input will inform policy at an early stage. In summary, Amendment 37 ensures that flexibility is balanced by responsibility. It allows ministers to respond to new risks while ensuring the expansion of a regime is evidence-based, proportionate and properly consulted upon. I would have thought that is what good law should look like, and I am surprised that at the moment the Minister seems unwilling to accept the amendment. I look forward to hearing her closing remarks. Thank you.
Thank you, Mr Balfour. Joe Fitzpatrick.
Thanks very much. Just a very brief intervention. I am very sympathetic to the two amendments, 64 and 65, in the name of Dr Gulhani. I wonder if in closing whether the Minister might consider agreeing to discuss these amendments further with Dr Gulhani in advance of stage 3, and if the Minister does agree to that, whether Dr Gulhani would agree to not press them at this stage. Thank you.
Thank you, Mr Fitzpatrick. Minister, to wind up.
Thank you, Convener. I'm grateful to members for the discussion of this group, which covers some very important issues. The complexity of some of this discussion illustrates the importance of the power to amend the schedule itself so that we can ensure that this bill remains up to date, even as the range of procedures on offer change, and I welcome support from my members. With regards to Dr Gulhani, Amendment 6 and clinical trials, they are regulated by the 2004 regulation, so only cover regulated trials. With regards to the point that Joe Fitzpatrick made with regards to Dr Gulhani's Amendments 64 and 65, I am very content, as with other amendments, to continue that discussion with Dr Gulhani as into stage 3. Of course.
Would the Minister consider for 6 putting regulated clinical trials in the wording?
I'm very happy to discuss that with Dr Gulhani leading into stage 3 of this bill process. With regards to Mr Balfour, I am very content to consider discussions with him on his amendment because I absolutely understand where it is coming from with regards to the underlying issues in his amendment. I welcome the indication that Mr Golden will not be pressing his amendments. However, if he does decide to press, I ask members not to support, and I will continue discussions with him into stage 3. I would like to remind members that I already intend for a consultation requirement to be added to all the affirmative powers in this bill, so I hope that you will all agree it is unnecessary to put in place further requirement, especially one that will prevent that power being used effectively. I urge members to support the amendments in my name, which are critical to ensure that this bill captures the intended procedures but does not capture anything else and works effectively with the licensing SSI. I move my amendments.
The question is that Amendment 6 be agreed to. Are we all agreed? Yes. The amendment is agreed. I call Amendment 7 in the name of the Minister, already debated with Amendment 6. Minister to move formally.
Move.
The question is that Amendment 7 be agreed to. Are we all agreed? Yes. The amendment is agreed. I call Amendment 8 in the name of the Minister, already debated with Amendment 6. Minister to move formally.
Move.
The question is that Amendment 8 be agreed to. Are we all agreed? Yes. The amendment is agreed. I call Amendment 9 in the name of the Minister, grouped with amendments as shown in the groupings. I point out that if Amendment 22 is agreed to, I cannot call Amendment 40 due to preemption. Minister to move Amendment 9 and to speak to all amendments in the group.
My apologies. This group of amendments goes to the very heart of this bill. It contains amendments to Section 4, which sets out the most important public safety provisions, where non-surgical procedures can be carried out and the need for healthcare professional involvement in these settings. These are the issues that have been the subject of most of the correspondence and representations that I have received, and I must make clear that I have listened carefully to all sides of the discussion. I will start by discussing my own amendments. Amendment 22 is the most substantial. It does not add to or remove any setting from the list of permitted premises, but provides additional clarity about these premises. Amendment 22 replaces the existing section 4(1) and 2 with a new subsection 1. Subsection 1A and B provides new drafting so that the permitted premises for HIS registered independent clinics and independent hospitals are those where the address is entered in the register maintained by HIS. Subsection 1B2 also makes clear that an independent clinic can include a vehicle. Subsections 1C to F are the same as in the bill at introduction, but with some minor technical drafting changes. Amendment 25 amends Section 4(5) of the bill to include definitions related to this new subsection. Amendments 9, 23, 24 and 31 are technical drafting changes proposed as a consequence of Amendment 22. These changes address concerns raised by HIS in evidence to this committee about the clarity of these provisions. The inclusion of vehicles may surprise some members, but in the case of dental settings, mobile settings were included in the bill at introduction, and this is consistent with how these settings are already able to operate. In the case of a HIS independent clinic, this has been made explicit, recognising it is possible but not easy for a vehicle to be equipped in the same way as a traditional clinic. Such vehicles already provide, for example, dental scanning and blood donation services within the NHS, and I would like to assure members that independent clinics, which are vehicles, would be inspected by HIS and would be expected to meet the same standards in relation to the appropriateness of fixtures and fittings as fixed premises. Amendment 22 also makes it clear that procedures must not be carried out from clients' homes. It would, however, be possible for a clinic to be established out of rooms in a provider's home or in a purpose-built outbuilding, because, again, such a setting can still be inspected by HIS and held to the same standards as any other clinic. I urge members to support all of the amendments in my name. I will now turn to other members' amendments in this group and the clear themes they fall under. Amendments in this group take a variety of approaches. Amendments 22 and 73 create an additional category of HIS regulated setting. Amendments 40, 44 and 61, Amendments 68 and 71, and Amendments 69 and 113 amend requirements of existing categories of HIS regulated setting. Other amendments provide for new licensing or registration schemes, such as Amendment 22A, 41, 42 and 60 on licensed non-healthcare premises, Amendments 22B and 43 on community clinics, and Amendments 22C and 112. A number of these amendments seek to allow businesses to operate without healthcare professional involvement. In respect of the licensing schemes proposed, the Civic Government Scotland Act 1982, Licensing of Non-Surgical Procedures Order 2026, has recently been improved by the Scottish Parliament to introduce a local authority-run licensing scheme for lower-risk non-surgical procedures. It is intended that the licensing scheme under the Order and Regulation of Higher Risk Procedures under the Bill will both commence at the same time. As such, there is no need for any amendment which introduces a new licensing scheme. I appreciate all of these amendments seek to address business concerns around the impact of this bill, with the focus being the cost and practicality of having a healthcare professional always present in a setting. I will take this opportunity to explain why I believe that the presence of a healthcare professional is essential. All the procedures currently described in Schedule 1 of the Bill carry some risk. Many of them require the use of a prescription-only medicine. The remainder are all likely, to various degrees, to require the use of a prescription-only medicine in addressing complications. We heard during the debate that these complications may not emerge immediately. However, I have clinical advice and examples, some shared in Parliament by Dr Gulhani, of complications emerging or being identified immediately and requiring immediate action to prevent serious adverse outcomes. In these cases, someone needs to be available to assess the situation and have the ability to prescribe or administer the relevant medication. The setting needs to hold supplies of such emergency medication. Non-regulated settings delivering non-surgical procedures are not able to routinely hold supplies of prescription-only medicine without the involvement of a suitably qualified healthcare professional. I cannot endorse any proposal that could allow procedures to continue to be undertaken without access to emergency medicines. With specific reference to Amendments 44 and 61 linked with Amendment 40, and which seek to create a prescription-only medicine governance process, and Amendments 69 and 113, which would require an arrangement for named prescribers to be attached to each permitted premises, there are concerns about the effect of these amendments on the reservation of the subject matter of the Medicines Act 1968 in the Scotland Act 1998. There are other advantages to the presence of a healthcare professional in settings providing non-surgical procedures. For example, a healthcare professional's involvement in consultation can support fully informed consent and considerations of risk, particularly with regard to existing health conditions. A healthcare professional also offers the wider assurance of professional regulation. Complaints can be made against such professionals to professional regulators with serious consequences where they are upheld. This is not the case for practitioners who are not healthcare professionals. For all these reasons, I urge members not to press amendments which would in any way undermine the connection between a permitted premises and the presence of a healthcare professional. Again, I urge members to support the amendments in my name, and I move Amendment 9.
Thank you, Minister. Maurice Golden to speak to Amendment 22A and other amendments in the group.
Thank you, Convener. And my amendments in this group are probing amendments around two areas. The first of which is permitted premises, and the rationale behind those amendments are to allow permitted premises to be out with a healthcare setting if they are able to meet the criteria of safety, which is essentially where I believe the committee and the Parliament are coming from on this. A licensed non-healthcare premises route could be aligned to risk level, infection control standards, inspection requirements to allow services to operate safely while maintaining accessibility for communities, and aligning premises requirements with the risk and complexity of procedures supports patient safety while avoiding unnecessary service closures or market consolidation. And the second group of amendments is around prescribers on premises, and essentially these amendments explore that requiring a prescriber to be physically present on premises as a default model risks creating barriers to service provision, and it also acknowledges that patient safety is not determined by physical presence alone, but by clear governance, accountability and access to appropriately qualified prescribers when clinically required. A named prescriber model within a defined geographic radius supported by robust protocols, escalation pathways and remote availability reflects how prescribing oversight already functions in the majority of cases safely and lawfully in many healthcare and aesthetic settings. Thank you, Convener.
Thank you, Mr Golden. Stuart McMillan to speak to Amendment 22C and other amendments in the group.
Thank you, Convener. Just before I do go into Amendment 22C, just once again want to thank the Minister for taking this bill forward and for listening to the concerns from the sector. Safety is paramount. It's a paramount driver for me. That's why when I engaged with the Scottish Government on this issue, it was always the thing that really kind of pushed me forward. And I don't believe you can actually put a price on people's safety. So some of the amendments that I'm putting forward may therefore be considered to counter that aspect about safety, but I will deal with them obviously in due course. So this particular amendment, 22C, is quite a simple amendment in theory, but I do appreciate that it may well be challenging to deliver. And I have noted also the Minister's comments. Since 2018, I've spoken to medics and non-medics involved in the industry, and with the Scottish Government consultation creating the 3 different categories, it was clear to me that those in the Group 2 category would be the hardest group to find a solution for, and I did reference this also in the debate at stage 1. So this amendment is a proposal to try to assist in that aspect. Fundamentally, the parts of the sector there are parts of the sector that have got no regulation, so trying to formalise the sector is crucial, in my opinion. Now, creating the registration requirements are vital in this regard, and having a register of those premises managed by a non-healthcare professional, I would suggest, is a positive start. If a non-registered practitioner undertakes a procedure which goes wrong, where is the penalty? There's none. If a registered practitioner, via his, undertakes a procedure that goes wrong, there are penalties and also reputational damage. So the amendment, in effect, attempts to introduce a level of professionalism to those who would therefore qualify. The regulations will need to be fully consulted with regards to what they require, and the way the bill has been drafted allows for that consultation to take place once the principle has hopefully been agreed. And regulation and providing a pathway to upskill, I would suggest also does need to be considered, and the industry is increasing and we are responsible for trying to make it safer. So with new procedures occurring at pace, the flexibility of much of the regulatory powers post-consultation is actually helpful. It's not an approach that would be welcomed, certainly across the Parliament in every single bill. And the Minister referenced the Delegated Powers Committee earlier on, and that's certainly an aspect that that particular committee has highlighted with regards to the framework consultation that we undertook and that the inquiry we undertook earlier on in this session. So for me, this particular amendment is really just about establishing the principle of those who qualify must be registered. Amendment 68 further supports the principle of non-medics being registered as being able to have a permitted premises. Once again, it's about professionalising the sector. We all know that some people have spent a great deal of money on training and also on the premises, and allowing those who qualify to register as a permitted premises is therefore positive. Now, there is also the regulatory aspect that comes with that responsibility, which has already been raised. The Amendment 71, this amendment is a proposal to highlight the level of training Some people in the sector already have, although not medically trained. Under the Scottish Credit and Qualifications Framework, level 11 is a master's qualification, a postgrad diploma, or a postgrad certificate, and also others. It's similar in Wales, and it's a vocational training and professional qualifications in England and Northern Ireland. My amendment is to provide a baseline of qualifications to allow people to work in the sector. Achieving a postgraduate qualification is difficult and challenging, and it does take a huge amount of time and effort. And I know from undertaking an MBA some years ago. But having this as the baseline could then provide an opportunity for upskilling, for particularly those who actually want to remain in the sector. And also I'm very much aware that Glasgow Caledonian University have got a course that they're working on. We've got one already ready to go in this regard as well. So there is clarification of the interpretation of Regulation 12 of the Healthcare Improvement Scotland requirement as to independent healthcare services, Regulations 2011, is very helpful, and also considering the minimum qualifications that are required. And I appreciate that if non-medic practitioners are to be regulated via HIS, there will be an impact on their function and costs. However, the fundamental issue of client safety will clearly be paramount. And if we all want the sector to grow safely, because the sector is growing, qualifications, upskilling and stringent regulations for new entrants must apply. And finally, Amendment 112. This is just a technical amendment to ensure that regulation goes through the affirmative procedure of scrutiny in the Parliament. And I know certainly the Delegated Powers Committee is something that obviously we referenced with regards to the report that was sent to published earlier on in the session. Thank you, Convener.
Sanders Gohani.
Thank you, Convener. I suppose I want to make some general comments on this group of amendments. I think if we talk about permitted premises and we're talking about HIS standards, what we're essentially saying is there needs to be a basic standard applied to anything that has a medical context to it. Now, some examples which I suppose would surprise a lot of people is your fridge. You can't just use a normal fridge. You have to use a medical grade fridge to store medicines and to store toxins and lots of other things. And you need to have documentation of the temperatures of that fridge. And you need to make sure that if you take the medication out of the fridge, you have a clear chain of documentation suggesting when you took it out to when you've used it to when you bin it. And so fizz and filler parties, something that we have spoken about in this committee, I'm pretty sure would not follow that bit of advice. We're talking about being able to clean the surfaces. You simply cannot accept going in to see a GP, going in to see a dentist, and sitting on equipment that cannot be cleaned or isn't cleaned. So anything that would water down his standards when it comes to injections and it comes to what I would suggest are medical interventions is something that we should really guard against. The other point that I'd like to make when it comes to the physical presence of a prescriber, I think we do need to make it clear exactly what we're talking about. But there are two issues that I have here. I used to do orthopaedics, and I'd done it for many years, and I would operate often alone in the theatre. But that list was never in my name. That list was in the consultant's name. Despite how senior I got, the consultant was in charge of the list, and there were other consultants, other people around to be able to come in if something were to go wrong. And it is very clear, and that is from a very simple surgical procedure such as a carpal tunnel, which you'd expect someone to be able to do at a rather junior level. It is not as straightforward as simply letting somebody crack on with it. And I'm very concerned, and it's something that I think I'd like to discuss with the Minister when it comes to stage 3, about this idea of giving blank prescriptions, because these medical devices or prescription medications, you need to be given a prescription that needs to be cashed, and then that medication needs to be used. And so what is happening at the moment is somebody is writing a blank prescription for botulinum toxin, which is the most deadly toxin we have, and has no idea how it's being used, whom it's being used on, the appropriateness of it. the documentation when it comes to informed consent. And so I do have a real worry. So as a GP, I trust my allied healthcare professionals. I trust my advanced nurse practitioners who have been doing their job for 20-odd years. I would not give them a blank prescription for antibiotics. They would discuss with me if they thought that they needed something, or they would independently prescribe for their patient. I wouldn't give them a blank prescription for cancer meds for a patient that came in. I certainly would, yes.
Thanks. I'm just thinking about botulinum toxin. It comes in a multi-dose vial, so that one vial would be used for more than one person. So that means the traceability of that one vial and its expiry date and the dosing might be different for each person that's a recipient.
Yeah, I would agree, and also the documentation about when that came out of the fridge, when it went back in the fridge, how long it's been open for. These are all things that are vital when it comes to being assessed by HIS and HIS looking at what you're doing and making sure that you're safe. And I don't think people are doing that right now. I'm sure some providers are. I'm not going to blanketly say that everyone is not doing things. But if you don't have regulations, you don't know what it is you should or should not be doing, and thus you wouldn't know whether you're following this or not. And that is my worry when it comes to watering down HIS standards. But also this idea of a blank prescription where you can just crack on and do it, despite the person who's written the prescription not really knowing what is happening with that prescription, and having this individual discussion about each patient and what you're doing. So I think that's something we should look at, because I'm pretty sure being an independent prescriber, as for example, a pharmacist, just an example, I'm not sure that was the point of being an independent prescriber, to be giving blank prescriptions out.
Thank you. Minister, to wind up.
Thank you, Convener. I'm grateful to members for the points raised in relation to this group. I urge members to support Amendments 9, 22, 23, 24, 25 and 31, and ask Maurice Golden and Stuart McMillan not to press the remaining amendments in the group. The amendments in my name are necessary because they ensure the permitted premises definition is as clear as possible for the providers of non-surgical procedures and for HIS as the enforcing body. The other amendments in this group would undermine the core safety protections that this bill offers. If I can touch briefly on the points that Dr Gulhani has made around prescriptions. These are conversations that we are currently having with the UK Government and MHRA. As you know, that is reserved. And I recognise the points that he has referenced there and happy to discuss further. HIS do look at these circumstances in their reviews and would refer to the MHRA if they spotted any issues. I'm happy to repeat what I've said elsewhere, that I do not want to disrupt business unnecessarily, but nor am I willing to compromise on safety in order to reduce that disruption. I'm happy to continue to work with members on other approaches to mitigate the impact on businesses, including existing business support and any guidance we can provide. I also want HIS to work with the Scottish Government to ensure that all their standards and requirements are appropriate to the services they regulate and consider any statutory standards in the same context. I believe there is scope to make changes to regulations to better accommodate settings which do a mixture of procedures in this bill and other beauty treatments. I'm happy to share more detail on this by correspondence. Finally, I'm happy to hear any other suggestions from members on steps which may mitigate the impact on businesses during and leading up to stage 3.
Thank you, Minister. The question is that Amendment 9 be agreed to. Are we all agreed?
Yes.
The amendment is agreed. The question is that Amendment 64 be... I call Amendment 64 in the name of Sandesh Gulhani, already debated with Amendment 6. Sandesh Gulhani, to move or not move?
Given my feeling around the importance of removing osteopaths from this, I will move this amendment.
The question is that Amendment 64 be agreed to. Are we all agreed? No. Committee is not agreed, and we will move to a vote. Those in favour of Amendment 64? Those against? Abstentions? The result of the vote on Amendment 64 is 2 for, 8 against. There were no abstentions, and therefore the amendment is not agreed to. I call Amendment 65 in the name of Sandish Gulhani, already debated with Amendment 6. Sandish Gulhani, to move or not move?
Not moved.
I call Amendment 36 in the name of Maurice Golden, already debated with Amendment 6. Maurice Golden, to move or not move?
Not moved.
I call Amendment 37 in the name of Jeremy Balfour, already debated with Amendment 6. Jeremy Balfour, to move or not move?
In light of the Minister's remarks, I will seek further conversation with her and not move today.
The question is that Section 1 be agreed to. Are we all agreed?
Yes.
I call Amendment 10 in the name of the Minister, already debated with Amendment 6. Minister, to move formally.
Moved.
The question is that Amendment 10 be agreed to. Are we all agreed? Yes. The amendment is agreed. Call Amendment 38 in the name of Maurice Golden, already debated with Amendment 6. Maurice Golden, to move or not move?
Not moved.
I call Amendments 11, 12, 13, 14, 15, 16 and 17, all in the name of the Minister and all previously debated. I'll invite the Minister to move the Amendments 11 to 17 en bloc. Does any member object to a single question being put to Amendments 11 to 17? No. The question is... Minister, can you move those amendments?
Moved en bloc.
Thank you. The question is that Amendments 11 to 17 are agreed. Are we all agreed? Yes. The amendments are agreed. Call Amendment 39 in the name of Maurice Golden, already debated with Amendment 6. Maurice Golden, to move or not move?
Not moved.
I call Amendments 18, 19, 20 and 21, all in the name of the Minister and all previously debated. I invite the Minister to move Amendments 18 to 21 en bloc.
Move en bloc.
Does any member object to a single question being put to Amendments 18 to 21? No. The question is that Amendments 18 to 21 are agreed. Are we all agreed? Yes. Thank you. We are agreed. The question is that Schedule 1 be agreed to. Are we all agreed? Yes. Thank you. We're agreed. So I call Amendment 1 in the name of Claire Hawkey, grouped with Amendments 2, 3 and 4. And I will move Amendment 1 and speak to all amendments in the group. I would like to thank the Scottish Government for working with me on these amendments. The provisions in this bill relating to age restrictions are important and were strongly supported by the committee. These amendments support and future-proof the bill's approach to age verification. In November, the First Minister announced the intention of the Scottish Government to develop an app which, amongst other things, will eventually provide a form of digital age verification. And it's clear that in future, businesses and services will be able to verify age in a greater variety of means than by asking people to produce traditional printed ID documents. Amendments 1, 2 and 3 remove the list of acceptable documents for age verification, that's section 2, brackets 4, and the ministerial power to amend this list, section 2, bracket 6, and replace these with a provision to allow the Scottish Ministers to specify in regulations the steps which can be taken to establish a person's age for the purposes of providing a non-surgical procedure. Due to the changes made by Amendments 1, 2 and 3, Amendment 4 makes a technical change to section 19, bracket 3, which sets out the regulation-making powers which are subject to negative procedure. to update the reference to the regulation making power in section 2 from section 2(6) to section 2(3). And the list of acceptable documents will need to be reintroduced by ministers via regulations before section 2 comes into force. And ministers will also need to consider whether digital forms of age verification can also be relied on by businesses providing these services. This digital age verification may not look like a traditional document and would therefore not be captured by the original power to add to a list of documents, and that's why this change is required now. These changes future-proof the bill, allowing for potential recognised digital forms of age verification, such as a digital proof of age app, to be included in the future. And the approach aligns with amendments proposed for other Scottish legislation, such as the proposed amendments to Section 4 and 4A of the Tobacco and Primary Medical Services Scotland Act 2010, ensuring consistency in age verification processes. The power to make regulations on acceptable proof of age remains technical and will continue to use the negative procedure, allowing for flexibility and scrutiny without substantive policy changes. Minister.
So you need to move.
Oh, I'll move the amendment in my name. I thought I did that at the start. Minister.
I fully support these amendments. The bill, as outlined currently, includes a list of acceptable forms of ID that allow providers to confirm that a person is at least 18 years of age to receive a procedure. This approach has been taken by previous legislation. As noted, in November 2025, the First Minister announced that an app will be launched in 2026. As this will at some point include digital proof of age, the bill should allow regulations to be made that can provide for this and other forms of ID. It is clear that such forms of ID may not be covered by the documents currently listed. The power to amend a list of documents does not therefore appear to be sufficiently future-proofed. It is therefore prudent to remove the list of ID documents from the face of the bill and give ministers the power to provide the list of acceptable forms of ID in secondary legislation in advance of offence provisions coming into force. I urge the committee to support these amendments. I've just finished.
You can take an intervention,
I can
Minister,
take an
if you wish.
intervention, yes.
Thank you. So I didn't want to interrupt what you were saying there, because obviously it's vital that we're able to ensure that under 18s don't get into this. But I wonder if in secondary legislation the Minister might consider looking at whether you introduce a new form of ID, it might be that the provider in good faith gets duped by false documentation and to sort of set out help for providers when it comes to especially new forms of ID they might not have seen before.
I think the member raises a very reasonable point. I would suggest that the secondary legislation will not be happening within this term of Parliament and would be for the Minister in this position after the election to make these decisions and recommendations.
Thank you. You've now concluded, Minister? Yes, okay. So in winding up, can I thank the Minister for her support and for the support of her officials, and I urge members to support amendments 1 to 4, and I move amendment 1. I press amendment 1. The question is that amendment 1 be agreed to. Are we all agreed? Yes. Call amendment 2 in the name of Claire Hawkey, already debated with amendment 1, and I move the amendment. The question is that amendment 2 be agreed to. Are we all agreed? Yes. Call amendment 3 in the name of Claire Hawkey, already debated with amendment 1, and I move the amendment. The question is that amendment 3 be agreed to. Are we all agreed? Yes. The amendment is agreed. The question is that section 2 be agreed to. Are we all agreed? Yes. We are agreed. The question is that section 3 be agreed to. Are we all agreed? Yes. I call amendment 22 in the name of the Minister, already debated with amendment 9. I remind members that if amendment 22 is agreed to, I cannot call amendment 40 due to preemption. Minister, to move formally.
Moved. I
call amendment 22A in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 22B in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 22C in the name of Stuart McMillan, already debated with Amendment 9. Stuart McMillan to move or not move?
Not moved.
I call Amendment 22D in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I remind members that if Amendment 22 is agreed to, I cannot call Amendment 40 due to preemption. Minister to press or withdraw Amendment 22.
Press.
The question is that Amendment 22 be agreed to. Are we all agreed?
Yes.
I call Amendment 23 in the name of the Minister, already debated with Amendment 9. Minister to move formally.
Moved.
The question is that Amendment 23 be agreed to. Are we all agreed?
Yes.
The amendment is agreed. I call Amendment 68 in the name of Stuart McMillan, already debated with Amendment 9. Stuart McMillan to move or not move?
Not moved.
I call Amendment 69 in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 24 in the name of the Minister, already debated with Amendment 9. Minister to move formally.
Moved.
The question is that Amendment 24 be agreed to. Are we all agreed?
Yes.
We are agreed. I call Amendment 41 in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 71 in the name of Stuart McMillan, already debated with Amendment 9. Stuart McMillan to move or not move?
Not moved.
I call Amendment 25 in the name of the Minister, already debated with Amendment 9. Minister to move formally.
Moved.
The question is that Amendment 25 be agreed to. Are we all agreed?
Yes.
We are agreed. The question is that Section 4 be agreed to. Are we all agreed?
Yes.
I call Amendment 42 in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 43 in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 73 in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 75 in the name of Fulton McGregor, grouped with Amendments 79, 100, 106 and 118. Emma Harper to move the amendments in Fulton McGregor's name, to move Amendment 75 and to speak to all amendments in the group.
Thanks, Convener. Apologies for Mr McGregor. He has been inadvertently delayed. He was intended on being here to speak to his own amendment. So I have his speaking notes for him, so I will be very concise. Amendment 75 places a duty on Healthcare Improvement Scotland to set standards for premises providing non-surgical procedures and requires that these standards are proportionate to the level of risk associated with the procedures being carried out. It further clarifies that premises offering only non-surgical treatments should be required to meet these proportionate standards rather than being subject to hospital-grade or overly burdensome requirements. The amendment seeks to maintain strong patient safety protections while avoiding unnecessary regulatory barriers that could exclude safe and responsible providers, limit access to services or increase costs without delivering additional public benefit. Thank you, Convener.
Thank you, Ms Harper. Sandesh Gohani to speak to Amendment 79 and other amendments in the group.
Thank you. 79 is to ensure that those who have complaints raised after receiving non-surgical procedures can benefit from a clear set of national guidelines. to follow in taking this forwards. I don't believe this is too onerous because this is something that would be set out in secondary legislation, and it would allow a very clear line of complaints to be made. Now, one of the things that I have heard is saying, well, if it's a single provider, how on earth could you create a complaint along those lines? And it's the same as being a single-handed GP. You still have to have a complaints procedure, and if you're not satisfied with the response that you get from the provider, then there should be a clear set of guidance on exactly how it is that you can put complaints in, and how that will then be followed through in a robust way. I would like to speak at 106 and 118, because the committee said in its Stage 1 report that it wanted the Scottish Government to ensure all providers are similarly and suitably trained and qualified to be able to undertake patient mental health screening and to ensure properly informed consent. So my amendment seeks to deliver this by ensuring comprehensive national guidance is in place for providers to refer to, which will assist them with mental health screening, because obviously we do not require providers to be fully mentally health trained. They do not need to be psychiatrists, but they do need to have some idea of how to have a quick screen, because body dysmorphia is estimated to affect 1 in 50 adults in the UK, and given its impact on body image, there is naturally a high likelihood that those suffering from it may seek a non-surgical procedure. And so having this discussion with the appropriate patient and client would safeguard in providing them with non-surgical procedures. The Minister's Amendment 21 rightly defines an injectable non-surgical procedure, something done for a cosmetic or well-being purpose, so as not to be able to sort of enter from the side as it is as such. And I do really support that. And given the recognition from the Minister that people do seek out procedures to improve their mental health, I do think it's important we ensure that proper guidance is in place to respond to that fact. So while the amendment focuses on body dysmorphia simply as a starting point, I believe it allows ministers to create guidance to cover any other mental health condition they feel is appropriate.
Thank you. Maurice Golden to speak to Amendment 100 and other amendments in the group.
Thank you, Convener. Amendment 100 is to ensure that HIS must publish standards and guidance about non-surgical procedures, and that providers of non-surgical procedures must comply with any standards and guidance published. So, relatively simple one that should be beneficial in terms of providing safety standards and guidance for the sector.
Thank you, Mr Golden. Minister.
I understand and support the intention behind these amendments, which relate to the settings of standards and establish clear guidance in the provision of a complaints process. These amendments take a number of approaches to setting these standards and have varying degrees of specificity. I will start by confirming my approach to amendments concerning guidance, of which this group contains several. I'm going to ask members with amendments in this group not to press those amendments, which I will discuss shortly, but I would be happy to engage in discussions on how a single amendment could be introduced in advance of Stage 3 to cover the topics members consider important. I note, for instance, Dr Gulhani's amendments 106 and 118 and his concerns around body dysmorphia and other mental health conditions, or Amendment 79, which concerns guidance on complaints processes. I expect both these to be matters which responsible practitioners in regulated settings will already be aware of. I can certainly confirm that Healthcare Improvement Scotland already requires providers of independent healthcare services to have a complaints procedure in place, and this provides an avenue for individuals to make an independent complaint. Alongside this, healthcare professionals are subject to the professional regulators' complaints processes. Therefore, the bill, as introduced, will deliver this intent, and it may not be necessary to reintroduce any further provision of this nature. I am, however, open to the idea that difficult issues around mental health concerns, as Dr Gulhani discussed, and how they impact on those seeking procedures is a matter which even experienced practitioners and professionals may benefit from further guidance on. Fulton McGregor's Amendment 75 is similar to the amendment by Maurice Golden, Amendment 100. Amendment 100 is a general requirement for HIS to publish standards and guidance. Amendment 75 requires proportionate standards and guidance, and also that relevant permitted premises must meet only the standards set by HIS under the provision of that amendment. These would effectively prevent some of the sensible guidance that HIS already has in place from applying, and would need this to be duplicated in a new form. I think that this is an overly complicated way of going about something. I do not see why, for instance, a complaint procedure suited to an independent travel clinic would not be suited to a cosmetic one. I am pleased to support the principles of the need for guidance, but propose to work with members ahead of stage 3 to introduce a single amendment that addresses all concerns raised. I would urge other members to support this approach too.
Thank you, Minister. Emma Harper to wind up and press or withdraw Amendment 75 in the name of Fulton McGregor.
So, thanks, Convener. I don't think I have anything more to add, but I will not move this amendment.
Okay. So the amendment's being withdrawn. Does anyone object to Amendment 75 being withdrawn? No member has objected. I call Amendment 44 in the name of Maurice Golden, already debated with Amendment 9. Maurice Golden to move or not move?
Moved.
The question is that Amendment 44 be agreed to. Are we all agreed? No. Committee is not agreed, and we will move to a vote. Those in favour of Amendment 44? Those against? Abstentions? The result of the vote on Amendment 44 is 2 for, 8 against. There were no abstentions, therefore the amendment is not agreed to. Call Amendment 75 in the name of Maurice Golden, Group...
76.
Oh, sorry?
76.
76, sorry. I call Amendment 76 in the name of Maurice Golden, grouped with Amendments 51, 105, 110, 117 and 119. I remind members that under Rule 9.12.6c, the presiding officer has determined that the financial costs associated with Amendment 105 would be significant. Therefore, Amendment 105 may be debated, but the question on it may not be put in the absence of a financial resolution. Maurice Golden to move Amendment 76 and to speak to all amendments in the group.
Thank you, Convener. This amendment in my name, as well as the other amendments in this group, are really seeking to ensure fairness in terms of the regulation of the sector. It is, in my opinion, that the sector should have been regulated at least a decade ago, perhaps before, and therefore, even as the bill is drafted, then there wouldn't be such a distinction in the market as we see it today. And through no fault of their own, non-aesthetics practitioners now face a very perilous future, and therefore this amendment seeks to assist in that transition to a new regulated sector. Unfortunately, neither the Minister, the committee members or anyone else can go back in time and ensure that the regulations were put in when, in my opinion, they should have been, but we are where we are now, and we face an issue with those who now face being out with the regulated sector without doing a significant amount of additional training. So essentially, this is an amendment to fix what Parliament once didn't do correctly, in my opinion. Thank you.
Jeremy Balfour to speak to Amendment 51 and other amendments in the group.
Thank you, Convener. Amendment 51 requires that the rates of any fees charged by Healthcare Improvement Scotland for registration are specified in regulation. This ensures that fee levels are set out in secondary legislation and therefore subject to parliamentary scrutiny. The purpose of this amendment is to provide transparency and accountability in how fees are determined. Registration fees represent a direct financial obligation on practitioners and businesses, and for many in this sector, particularly sole traders and small partnerships, even moderate cost increase will have a meaningful impact on their business. Without clarity on how fees will be set or what level they may reach, businesses face uncertainty. That uncertainty can affect financial planning, investment decisions and workforce stability. It is therefore appropriate that Parliament has oversight of the level of fees associated with the regime it is establishing. This amendment does not prevent fees from being charged, nor does it challenge the principle of cost recovery where appropriate. Instead, it ensures that fees are clearly defined, transparent and open to scrutiny. Setting them out in regulations provide predictability for business and allows members to assess whether the charges are proportionate to the regulatory services provided. If agreed, fee levels will be publicly defined and subject to parliamentary consideration. This will provide clarity and support and confidence that charges are fair and justified. This already happens in other sectors. If this amendment is not accepted, there will be less transparency about how fees are determined and reduced opportunity for Parliament. Businesses could face uncertainty about future costs, and Parliament would have more limited role in assessing the financial impact of the regime. Ultimately, what Amendment 51 seeks to ensure is that the financial foundations of any new regulatory system are clear and accountable, and is it safely implemented so that businesses, whether small or large, are not indirectly affected. Thank you.
Sandesh Gohani to speak to Amendment 105 and other amendments in the group.
Thank you, Convener. I think it's quite clear the presiding officer stated that I cannot move this amendment due to the potential financial constraints that it might cause. But I do think it's important to discuss it, and I certainly would love to hear what the Minister has to say about this. The idea was not to be financially burdensome. It was not the idea of this amendment was not to create a huge amount of money available, but more to be able to create an ability for current providers to move into regulation with guidance. Now, if the wording is wrong here because it says financial assistant, then perhaps it would be better if I took that out and talked about advice, support, written guidance that would be available. And the idea was this would all be in, it wouldn't be on the face of the bill, it would all be subsequent to the bill passing. So that would again give ministers a flexibility to be able to provide what they felt was appropriate. But I do think it's very important that existing providers do get help and guidance and support to move to, for example, his standards and other important patient safety aspects. And that's the point behind the amendment. So I shall be withdrawing them as instructed, but I do think it's important to discuss it.
Thank you. Carol Mochan to speak to Amendment 110 and other amendments in the group.
Thank you, Presiding Officer. I think, like others, I just want to mention from the amendments such as 105 that Scottish Labour has really would support the Government in exploring how best to approach regulation and licensing of non-surgical cosmetic procedures. But in considering the proposed legislation, we have also sought to balance the need for fair and appropriate regulation that prioritises prioritises public safety whilst not putting unnecessary requirements on the service, and that we get the right support for the current practitioners as well. So my amendment 110, the purpose behind this amendment is to ensure that proper checks and balances are put in place. It would require the Scottish Government to assess what support has been provided to industry within 12 months and 2 years of royal assent. This arose from the concerns about the need to ensure many skilled practitioners aren't left behind. It would require Government to assess what support had been provided to independent and non-medical providers, including training opportunities to upskill, available guidance and qualification pathways. It would also require the Government to report on whether any financial support for remote and rural businesses had been offered. And then to conclude, the Government has provided assurance that proper support and guidance have been put in place, which we really support, but this amendment would require the Government to report on this. Thank you.
Thank you. Minister.
Thank you, Convener. I'm grateful to members for their contributions to the debate on this group, as well as for the amendments submitted. While I'm urging members not to press these, I understand the issue that members are seeking to address and have sympathy for businesses that have developed and flourished in this sector in the absence of regulation and guidance. I appreciate that most of these businesses have tried their best to provide a safe and responsible service. I trust that to some degree these are probing amendments and that members are looking for me to put on the record the support that will be in place for businesses as regulation is introduced. I want to remind members of the options available to businesses and the consideration I've given about minimising business impact while prioritising safety. Not all aesthetic businesses perform procedures regulated by this bill. Some will be affected primarily by the licensing scheme to be introduced under the Civic Government Scotland Act 1982, similar to licences for tattoo and cosmetic body piercing businesses. I'm not aware of any concerns that that scheme will be onerous. Some businesses may adjust their business model, so they need not operate from a permitted premises by choosing to provide non-surgical procedures regulated by the licensing scheme rather than those regulated by the bill. Other businesses will want to continue providing procedures like Botox, and they now have a regulatory framework which sets out how they can do so. I've spoken to businesses who already have or have previously successfully worked under the model the bill sets out. Where businesses are adjusting, they will be able to rely on support from existing services such as Business Gateway, who provide sector information and tailored business guidance. They can seek guidance from HIS, who I know provide information to prospective businesses about the implications and requirements of HIS registration. Some businesses will have capital costs that might present a short-term hurdle. They will, of course, be able to access support from the range of existing grant schemes available to small businesses, signposted by Find Business Support, or from local authorities and enterprise agencies. Of course.
Thank you. So I've been approached by a provider who has applied to HIS to get registered and simply has not heard anything back for a long time. So that's the type of guidance. You know, what happens in the event of HIS being given a huge amount of work to do and a backlog? It's not fair on businesses who are trying to have to stop whilst HIS look at that backlog.
I agree with the points Dr Gulhani has made, and I approach some of them later on in my speaking notes. Noting the concern about the impact on businesses, I also want to be clear that I am happy to consider other action. We will talk about the time before key provision. We will talk about the time before key provisions in this bill come into force in the final group of amendments. I also want the Scottish Government to work with HIS and engage with businesses to consider carefully HIS's requirements and determine whether any could be amended to ensure that they are suitable for the full range of businesses that HIS will regulate. We must retain the requirement for a healthcare professional to be on site, the importance of which I highlighted in Group 3, where procedures under the bill are being performed. Consideration is being given to removing the need for that healthcare professional to be present in a service when non-regulated procedures take place. That said, I do not think there is any need to put in place a support fund, such as that envisaged by Sandesh Gulhani in Amendment 105, and the consequential changes proposed in Amendments 117 and 119. And as the convener has noted, as has Dr Gulhani, we will not be voting on Amendment 105 today, given the bill does not have a financial resolution and the presiding officer has determined that the cost of the amendment would exceed the threshold. There is also no need for a fund to be established to ensure that guidance is put in place, but I refer members to the comments that I made in the previous group of amendments relating to standards, guidance and requirements for providers. I am willing to work with members on the inclusion of an overarching provision in the bill requiring the Scottish Government to produce guidance on a number of matters, given the number of amendments of this nature. The final element of this proposed fund concerns direct financial support, and I think Dr Gulhani is realistic about this element, where the costs that businesses are concerned about ongoing costs, for instance, around employment. I do not think it would be reasonable or affordable to subsidise these businesses using finite public monies. It would also be uncompetitive in a sector where many businesses are already meeting the cost of HIS registration whilst receiving no such support. Amendment 110 takes a different approach, and I'm grateful to Carol Mochan for this amendment. I note this is one of a number of amendments concerning potential review provisions, including 109, also in Ms Mochan's name. The majority of these are to be considered in Group 11. I will say more of them at that point, but for Ms Mochan right now, I want to say that I would be very happy to work with her on Amendment 110 and with other members on how a single review provision can also consider the support available to businesses to ensure that the issues that Ms Mochan raises can be addressed. Amendments 51 and 76 focus less on support for businesses and more on the imposition of costs on them. I must admit that I do not see the need for Amendment 51 in Mr Balfour's name. The Scottish Ministers already have the power to set maximum fees for registration with his in regulations under Section 10Z5 of the National Health Service Scotland Act 1978. Ministers are required to consult with service providers before making regulations under the 1978 Act, and HIS consults with their registrants in evaluating these fees on an annual basis. Of course.
I suppose I'm just looking to the future. What happens if the Minister, the Prime Minister and the organisation say wants to increase it by over 100%? What scrutiny would Parliament have in regard to that? This simply allows Parliament to step in if it was excessive.
My understanding is, and I will correct the record if I'm incorrect, but Parliament does vote on the order setting the maximum fees every few years. So there is a check, but I will get back directly to Mr Balfour around that. I would suggest that Mr Balfour does not press the amendment. I would also urge Mr Golden to consider the provision in the 1978 Act concerning the setting of fees. This requires HIS to set their fees, which will be set at a level subject to the statutory maximum set by ministers and regulations with regard to their reasonable expenses in carrying out their functions. This appears to me to be a very reasonable basis for fees to be set. Any alternative might prevent HIS from covering their own costs and open the prospect of the public purse subsidising this sector in perpetuity. The other elements of Amendment 76 compares the costs incurred by businesses in relation to enforcement and the level of penalties. In the former case, I would welcome further discussion with Mr Golden if there is a concern he is aware of that his inspection or other enforcement activity is burdensome for their current registrants, and also noting Dr Gulhani's point as well. Very happy to discuss that situation with him. In the latter case, I note that decisions regarding prosecutions are a matter for the Crown Office and Procurator Fiscal Service, and that the appropriate level of fines to be applied following conviction will be a matter for the courts to determine according to the facts and circumstances of the particular case. I will say more about this under Group 9, which relates to enforcement, but if a court considers it appropriate to set a stiff penalty to someone who has knowingly provided a high-risk procedure to a child, I do not want anything in this bill to prevent them. For these reasons, I am asking members not to press these amendments, but in a spirit that I am very much happy to work with members on addressing some of the underlying concerns behind them. In the meantime, I hope my comments have been helpful and reassuring.
Thank you, Minister. Maurice Golden to wind up and press or withdraw Amendment 76.
Nothing further to add other than to withdraw Amendment 76.
Maurice Golden wishes to withdraw Amendment 76. Does any member object? No. There are no objections, so the amendment is withdrawn. I call Amendment 77 in the name of Sandesh Gohani, group with amendments as shown in the groupings. Sandesh Gohani to move Amendment 77 and to speak to all amendments in the group.
Thank you. Amendment 77 requires insurance and indemnity by providers. Now, responsible providers already do this. And so I think that it's perfectly reasonable that if you go to a provider of any sort, that they actually have indemnity for their premises and they have insurance for themselves. I also want, in Amendment 78, to ensure that prospective patients have informed consent. Now, informed consent isn't as straightforward as saying, oh, I see you've come here for Botox, let's crack on. Informed consent is about discussing the potential risks, the side effects. There even is a place for a cooling-off period to ensure that the person that is seeking the procedure gets appropriate levels of conversation through it. Amendments 81 and 103. This is really important because it was recommended by the Scottish Medical Aesthetics Safety Group, and I believe it closes a loophole that currently exists in the bill. There are only 9 botulinum toxin type A products authorised for use in the UK by the MHRA, and the patient safety instructions that accompany these products clearly state that they can only be administered by healthcare professionals and not members of the public. And as drafted, I'm concerned that the bill does not currently prevent members of the public from administering Botox type A, meaning that it's ignoring the manufacturer's safety instructions and undermining MHRA's rigorous risk assessment and licensing requirements. So my amendment seeks to close this loophole in the interests of public safety and ensures only regulated healthcare professionals can administer Botox type A. Amendments 92, 95 and 87 seek that people qualified to conduct procedures that are unsupervised to do so, and it looks at ensuring that we define what a licensed medical doctor, as a person registered with the GMC, it seeks to ensure that there is consequentials in 87 that removes the need for ministers to make regulations about supervision, as that is instead covered by Amendment 92. I do have a lot of amendments, so I do apologise for going through so many. Amendment 95, I am very much looking to provide a definition that an advanced medical practitioner is somebody who gets to be independent, because I think that it's important we don't have a loophole here where somebody trains, for example, to be a dental nurse, which doesn't have a significantly long length of training, simply to then get into the field of being into this field of aesthetics. I think that people who have experience and who are able to prescribe should be those that are able to be independent when it comes to the clinic that they run. I also wish to look at the meaning of supervision. I think that it is really important that that word is defined, and ideally I would like to see the definition of supervision on the face of the bill, because I do think it is vital that it is clear for everyone, and there are no, for example, legal challenges or anyone saying that they are supervising when they're online in the Bahamas rather than actually there in the clinic, or whatever that definition happens to be. And Amendments 99 and 120, I am looking for guidance on high-risk clients. These are probing amendments. I had a discussion with the Minister about them, but essentially it was for the discussion came about from the Cleft Lip and Palate Action Group, because I was looking to ensure that patients who have high risks are looked after by practitioners who have the appropriate skills to deal with the high risk patients. But I shan't be pressing those two amendments. Thank you.
You move Amendment 77, please.
Moved.
Thank you. Fulton McGregor to speak to Amendment 80 and other amendments in the group.
Thank you, Convener. Can I start by firstly thanking Emma Harper for speaking to a previous amendment, 75. Trains that went through Bathgate today were all cancelled, causing all manner of difficulties. But Emma Harper put forward my amendment much more articulately and succinctly than I would have, so thank you for that. Convener, all my amendments today come from the same place, having spoken to a number of constituents who spoke to me with concerns relating to the bill. And like others we've already heard this morning, they tried to bring to the fore the importance of recognising the people whose lives and livelihoods may be directly shaped by the decisions we take on this bill. The non-surgical procedures sector in Scotland is largely made up of self-employed practitioners, mostly of whom are women, many of whom are young working-class women, building and sustaining small businesses in the local communities. They have invested in training, premises and insurance, and they take seriously the responsibility to their clients. And I know that it's not the government or the bill's intention to harm this particular group. In my engagement with constituents who are in that sector, their message has been consistent. These practitioners want clear standards, recognised qualifications and an appropriate regulatory framework. They don't oppose the bill, and they understand the importance of patient safety and of maintaining public confidence. However, at the same time, they are seeking a system that reflects the level of risk involved in different procedures and the scale of the businesses delivering them, a fair and just system that doesn't unduly penalise them. My amendments, therefore, across several groups are intended to support that balance. They aim to ensure that standards for premises, training and enforcement are aligned with risk, are workable for small providers and provide clarity for those seeking to operate responsibly. In doing so, they recognise both the importance of protecting patients and the importance of sustaining a sector that provides employment, opportunity and valued services across Scotland. I want to put on record my thanks to several constituents who have taken the time to educate me on this issue and let me know their concerns. Particularly, I won't name them all, but particularly Sabrina Kilter, Joanne Haggerty and Paul Adams. I'm very grateful to them. Movement to my amendments 80 and 115 in my name. Amendment 80 introduces a statutory duty on Scottish ministers to establish minimum training and qualification requirements for those providing non-surgical procedures through regulations. It allows different standards to be set for different procedures and requires that these are proportionate to the risks involved, ensuring that regulation targets genuine patient safety concerns arising from inadequate training rather than professional background. By mandating regulated treatment-specific qualifications for all practitioners, including healthcare professionals, the amendment promotes consistent safety standards, professional parity and alignment with emerging UK best practice, strengthening public confidence and patient protection across the sector. Amendment 115 is a consequential amendment to set the procedure for these regulations. Above all, this reflects what responsible practitioners have told us they want: clarity about what is required, recognition of their skills and a fair system that applies equally to everyone delivering these treatments. It gives those working hard to meet high standards the confidence that their professionalism will be recognised and the public can have assurance in the qualifications behind the services they receive. I should also say, Convener, before finishing, that I have had discussions with the Minister's office, and my intention with these motions at this stage is for them to be more of a probing nature. With the obviously we'll hear what the Minister says, but obviously with the aim to perhaps doing some more work ahead of stage 3. So I just wanted to put that on the record just now. Thanks very much.
Gillian Mackay to speak to Amendment 83 and other amendments in the group.
Thanks, Convener. My amendments in this group have been worked up with the Cleft Lip and Palate Action Group and probably speak to some of the issues that Sandesh Gulhani has already raised. Amendment 83 places a duty on Scottish ministers to have regard to people whose risk of harm from non-surgical procedures is increased because of congenital facial difference, prior facial surgery or altered anatomy and scarring when making regulations under Section 5. While the initial set of regulations may well include appropriate protections for these groups without the need for primary legislation, regulation in this area will inevitably evolve as new procedures, products and techniques emerge. There's a real risk that people with increased vulnerability could fall by the wayside over time. By embedding this consideration in the legislation itself, the amendment provides a lasting safeguard and ensures that these higher risk individuals remain visible and protected as the regulatory framework adapts. Amendment 88 enables regulations to impose different or additional requirements where individual client risk factors are present, including risks linked to medical history or anatomical considerations. Risk is not uniform across the population. For example, a person born with a cleft or someone who's undergone multiple facial surgeries may have altered anatomy or scar tissue that significantly increases the likelihood of complications from non-surgical procedures. This amendment ensures that the regulatory framework can respond to those realities, allowing proportionate additional safeguards where higher risk is identified, rather than applying the same requirements to every client regardless of clinical context. Amendment 89 requires providers to carry out and document a pre-procedure assessment of relevant medical history and to follow enhanced informed consent procedures where factors are identified that may increase the risk of harm. At present, there is no consistent requirement to assess medical history or anatomical risk before non-surgical procedures are carried out. This amendment embeds basic patient safety principles into the regulatory framework, ensuring that risks are identified in advance and clearly explained to clients. It doesn't ban procedures, but it helps ensure that decisions made by both the practitioner and the client are made with a proper understanding of potential harms, particularly for people with more complex clinical backgrounds. And Amendment 98 requires Scottish Ministers to publish guidance on how the Act applies to individuals whose risk of harm may be increased due to congenital facial difference, prior facial surgery or altered anatomy. It also allows the guidance to cover identification of higher risk clients, additional safeguards and appropriate referral pathways. Clear guidance benefits both practitioners and clients. For practitioners, it provides clarity on how to recognise higher risk situations, when additional precautions are needed and when referral to clinical services is appropriate. For clients and patients, it improves transparency and helps them understand why certain procedures may require extra safeguards or specialist input. While early guidance may include these protections without the need for primary legislation, guidance will change over time. And by requiring this guidance in statute, the amendment helps ensure that higher risk groups are not overlooked as practice, technology and regulatory priorities evolve.
Okay. Maurice Golden to speak to Amendment 46 and other amendments in the group.
Thank you, Convener. I'll speak to 46, 47, 91 and 58 in my name. I think the first point to add is that data on safety is lacking in this sector. It's one of the reasons why it needs to be regulated. But even in regulated settings, the difficulty is accessing exactly when, unfortunately, things go wrong. There's inclusions, at what point they occur, both in situ and beyond. But nonetheless, this group is really about ensuring that there is a proportionate risk-based approach in the absence of that data. And ultimately, my amendments in this group seek to provide that proportionate approach to the new regulated practice in this space. And I foresee that depending on how this grouping of amendments are voted on, there might be a requirement for some condensing and tweaking at stage 3. But that's me just now.
Thank you. Stuart McMillan to speak to Amendment 84 and other amendments in the group.
Thank you, Convener. I proposed this amendment based on the Governance and Prescribing Assurance document, the Medical Aesthetics, his Registered Independent Clinic Scotland publication, and also the 2011 regulations that I referenced before. Under Section 6 of the former, it states that prescribers must only prescribe within the competence following an appropriate consultation that establishes medical history, and it goes on a bit further than that. The 2011 regulations are clear that a suitably qualified healthcare professional is working within the independent healthcare service, whilst service users are present. And certainly Dr Gohani referenced the 9 botulinum toxin type A products authorised for use in the UK under the MHRA guidelines. So also, Dr Gohani also referenced this with regards to some of the other amendments. So fundamentally, this particular amendment is about safety. as I stated at the very beginning in my contribution earlier on today. So it's about safety, and this amendment is to try and establish a base minimum for newly regulated practitioners. But I am conscious that, obviously, with the amendments from earlier on this morning, obviously some that haven't been moved, and I predict that I'm probably going to not be moving this one either. Thank you.
Thank you. Minister.
Thank you, Convener. This is a complex but important group, and we'll need a bit of time to address all of the amendments. After consultation, we announced the intention for 3 groups of procedures. Group 1, procedures undertaken under a local authority licence, which will be achieved when the SSI that was made on the 12th of February this year takes effect. Group 2, procedures that could be undertaken by non-healthcare professionals working in a clinical setting with supervision by a healthcare professional. And Group 3, procedures that could only be undertaken by a healthcare professional. The bill covers procedures in Groups 2 and 3, but does not differentiate between them. It does not specify who may undertake procedures, nor what form supervision may take. The bill provides for the key safety protections related to age and ensuring that procedures are only undertaken in a regulated setting where we expect the right healthcare professionals to be available. Once issues around the UK Internal Market Act are worked through, we will put in place further regulations that cover training requirements for practitioners, how supervision should operate, and restrict the riskiest procedures so they can only be undertaken by a healthcare professional. I will turn first to Dr Gulhani's amendments 81 and 103. These amendments would put in place specific provisions for Botox in many ways resembling the approach we intend to take for Group 3, that they may only be undertaken by a healthcare professional. This matches the approach in a range of European countries and the strong support for such a provision from consultation responses. However, I am also mindful of the strong representations that a non-healthcare practitioner can carry out the actual procedure safely. It is necessary for a healthcare professional to make out the initial prescription, given it is a prescription-only medicine, and to support consideration of whether Botox is right for the client, and to be available to manage complications. Complications can arise whoever the practitioner may be. Dr Gulhani's amendment would therefore restrict the practice of non-healthcare professionals in a way which is not necessary. Additionally, the effect of 81 and 103, which create an offence in relation to the provision of Botox, a prescription-only medicine, is to make provision which falls within the subject matter of the Medicines Act 1968. This is a reserved matter under Schedule 5 of the Scotland Act 1998. This therefore appears to be out with legislative competence, and so I urge the member not to press these amendments. However, the points that Dr Gulhani has just raised I think are important, and as part of our ongoing discussions with the UK Government, we will ensure that we highlight these as well. I will now turn to amendments 58, 84, 87, 92, 95 and 97, covering supervision, which the Scottish Government intends to resolve through future regulations. The principles of supervision may change over time and will be closely impacted by, for example, the training standards set. The broad principles set out by Mr Golden in subsection 1 of Amendment 58 are likely to be features of future regulations. The proposed amendments may also overlap or duplicate existing requirements under professional guidance or elsewhere. I appreciate Mr Golden's amendments are largely focused on making practice easier for non-healthcare practitioners, but note he is proposing a model of remote supervision that I do not think is appropriate. It would weaken safety protections, and I do not think it provides the flexibility that practitioners are looking for. The cost of a professional to observe the procedure using technology would still need to be factored in, and in-person partnership is a more effective approach to safety and may allow the professionals working in parallel in a setting. I would be very concerned that this amendment would undermine the fundamental safety intentions of the bill that I covered in Group 3. Therefore, I cannot support Amendment 58 and would urge Mr Golden not to press it, and if he does, I would ask members not to support it. Dr Gulhani's Amendment 97 asks ministers to ensure a definition of supervision is in place before regulations are made under Section 5. I am happy to confirm that specifying the basis on which procedures can be undertaken as a part of the Section 5 regulations to ensure that they are done safely is a priority, alongside training standards and restricting the highest risk procedures to healthcare professionals. I cannot say which matters will be resolved soonest. That is a matter for ministers after the election. If regulations on other matters are ready first, I certainly would not want them to be delayed. I therefore cannot support Amendment 97. Dr Gulhani's amendments 87, 92 and 95 relate to supervision because they replace ministers' ability to make regulations to specify who may provide or supervise the provision of a non-surgical procedure and replace it with a list of individuals who may perform procedures unsupervised. This includes an advanced medical practitioner, a health and care practitioner with a qualification encompassing clinical practice, leadership and management in education and research. In respect of Amendment 92, it appears that it may be out with legislative competence as a result of the medicines reservations in the Scotland Act 1998. Mr Macmillan's Amendment 84 also addresses supervision, suggesting minimum staffing ratios. There are concerns that this amendment may be out with legislative competence. This is as a result of the regulation of the health professions, which is reserved under Schedule 5 of the Scotland Act 1998, and the effect of the amendment in relation to the medicines reservation in the Scotland Act 1998. We do not yet have a definition of supervision, at least in part because we are still working through the implications of the UK Internal Market Act, which does not allow us to set training and supervision standards for Scotland, which would operate in the manner in which the Scottish ministers would like them to. Now is not the time to specify who can or cannot perform procedures without supervision. This is a matter for future regulation as soon as is practical, and so I cannot support Amendments 84, 87, 92 and 95. The next set of amendments to consider in this group are Amendments 77 and 78 in the name of Dr Gulhani, which seek to impose direct requirements on providers in relation to insurance and indemnity and aftercare information. These are entirely reasonable requirements, but I would like to reassure Dr Gulhani that insurance and indemnity requirements already form part of HIS's regulation of the settings registered with them. The appropriate place for these matters is in HIS guidance or in the requirements placed on HIS registered settings through regulations under the National Health Service Scotland Act 1978. Similarly, aftercare information should be a basic part of practice in this sector, and again, guidance would be an appropriate place to address this. I cannot therefore support Amendments 77 and 78. In relation to the Amendments 80 and 115 in the name of Fulton McGregor, these seek to impose direct requirements on providers in relation to training requirements. The bill already makes provision for the Scottish ministers to make regulations setting out training or qualification standards, and once the issues surrounding the UK Internal Market Act are resolved, it is the intention to set training and qualification standards for providers of non-surgical procedures. Amendment 96 in the next group in the member's name, and which I will be urging the committee to support, also addresses this issue. I hope this addresses the member's concern and note his comments regarding his amendments. I would now like to turn to those amendments which related to the power to be conferred on ministers to make regulations under Section 5, making further provision about non-surgical procedures by regulations. 23 amendments have been lodged that change or add to Section 5. A further 5 make additions to go immediately after Section 5. Not all of these are to be debated in this group, but I hope members will appreciate that it would not be possible to accept such a high number of overlapping and sometimes conflicting amendments. In this group, amendments 83, 46, 47, 91, 84, 87, 92 and 95 all in some way restrict or direct the use of Section 5 powers by ministers, seeking that Scottish ministers must consider or make provision for a whole range of issues such as provision about consultation and consent, record keeping, traceability of injectables and aftercare. Amendment 91 would prevent any restriction to providing non-surgical procedures being made based on the professional status of an individual. This would prevent ministers from restricting who can provide even the highest risk body augmentation procedures. I cannot support this amendment. There are times when it will be right to restrict the carrying out of certain procedures based on the professional status of the provider, and I suspect the member would agree with me that this blanket limitation was not his intention. Amendment 46 requires that any regulations made under Section 5 must make provision for the classification of non-surgical procedures into categories of risk and potential harm, having regard to available evidence on harms and complications. It would be a significant undertaking to categorise procedures in more detail than we have done each time regulations under Section 5 are made. This would also limit the Scottish Government's ability to react quickly to novel procedures or to changes to how existing procedures are delivered. The requirement to consult on regulations taking the affirmative procedure in my Amendment 35 will take account of the risks and potential harms of procedures in relation to any changes the regulations make. I therefore cannot support Amendment 46. Amendment 47 provides that regulations must make certain requirements on providers. And although the matters discussed are appropriate, I again want to maintain flexibility for these matters to be addressed in guidance or regulations as appropriate, and to avoid anything that would duplicate existing requirements elsewhere. I therefore cannot support Amendment 47. The next amendments in this group I want to consider are Amendments 83, 88 and 89 by Gillian Mackay, which address the heightened risk of non-surgical procedures to clients with pre-existing conditions, such as prior surgeries or altered anatomy. Amendment 83 calls for the Scottish Ministers to have regard to the need to protect individuals at greater risk of harm when making regulations under Section 5, whereas Amendments 88 and 89 provide that Ministers may exercise their powers to make provision for different or additional requirements and ensure providers carry out documented pre-procedure assessments and informed consent to procedures. The requirement for the procedures covered by the bill to take place in settings where a healthcare professional is available takes account of scenarios such as those set out by Gillian Mackay in Amendment 83, where clinical input is required to determine whether a procedure is suitable for a client. If any further provision is required in this respect, it may be provided in guidance, but I do not think any duty is required for ministers in order to ensure that these matters are considered. Instead, this would encumber the exercise of power. Amendments 88 and 89 are also not strictly necessary, but if the member wishes to press them as a further signal of the types of matter we may need to consider in the future, I understand that. And in the spirit of compromise, I would be happy to support these amendments. This is because, unlike Amendment 83, these amendments would not encumber the wider use of the power. I ask for the member not to press Amendment 83. The final amendments I will turn to in this group are Amendment 98 by Gillian Mackay and related Amendments 99 and 120 by Dr Gulhani. These amendments offer two very similar approaches to ensuring additional protections to high-risk clients and require guidance to be produced. I have already discussed guidance. I do not think it's helpful for this bill to contain multiple guidance provisions, so I would refer members to my comments during Group 5 and ask members to work with me and each other on a Stage 3 approach to this. This has been a substantial group, and I think it demonstrates the level of care that has been put in by members into considering safety and risk issues. There is time before Stage 3 if members are willing to work with me to agree approaches to concerns that can be endorsed on a consensual basis, whether or not that requires anything to be put on the face of the bill. For the time being, I will repeat my support for Amendments 88 and 89, but urge other members not to press their amendments, and if they are pressed, I would ask that members do not support them. Thanks.
Thank you, Minister. Sandesh Gohani to wind up and press or withdraw Amendment 77.
Thank you. There is a lot in this grouping, as the Minister has said. I am concerned about the fact that we currently, I am absolutely sure, have people providing non-surgical procedures who don't have both insurance and indemnity for their premises. And so, you know, the point of this bill is obviously to make everything safe and to tighten things up. So I think it would be very important to have further discussions around this to make sure that it is absolutely vital that happens. It's unacceptable, I think, to not be insured as a provider. I do agree with the Minister on the high-risk groups, which is why I will be withdrawing 81 and 103, and for 77, given the further discussions that are needed, but I won't be pressing 77.
Thank you, Dr Gohani. The amendment 77, Dr Gohani wishes to withdraw. Does any member object? No. There are no objections, so the amendment is withdrawn. I call Amendment 78 in the name of Sandesh Gohani, already debated with Amendment 77. Sandesh Gohani, to move or not move?
Again, given the importance, further discussion with the Ministers, but not moved.
I call Amendment 79 in the name of Sandesh Gohani, already debated with Amendment 75. Sandesh Gohani, to move or not move?
Moved.
The question is that Amendment 79 be agreed to. Are we all agreed? No. Committee is not agreed. We will move to a vote. Those in favour of Amendment 79? Those against? Abstentions? The result of the vote on Amendment 79 is 4-5 against 5. There were no abstentions. There is, as a result, is a tie. I must exercise a casting vote, and my casting vote is against the amendment. Therefore, the amendment is not agreed. I call Amendment 80 in the name of Fulton McGregor, already debated with Amendment 77. Fulton McGregor, to move or not move?
Not moved.
I call Amendment 81 in the name of Sandesh Gohani, already debated with Amendment 77. Sandesh Gohani, to move or not move?
Given what was said, I think, again, this is one that does require further discussion, so not moved.
Thank you. I call Amendment 83 in the name of Gillian Mackay, already debated with Amendment 77. Gillian Mackay, to move or not move?
Not moved.
I am going to briefly suspend this meeting for a break. We'll be back in about 10 minutes. I call Amendment 45 in the name of Maurice Golden, grouped with amendments as shown in the groupings. Maurice Golden to move Amendment 45 and to speak to all amendments in the group.
Thanks, Convener. I move Amendment 45 in my name. Essentially, these amendments in my name are in relation to making further provisions around how regulations are fit for purpose. In the earlier grouping, Group 6, this was largely focused around costs and financial provisions. In this grouping, these are across a range of different facets, including training, timescales for compliance, phased implementation, as well as the assessment of any regulations as defined by the Scottish Government, and essentially help to provide a pathway to future regulations and ensure that those regulations are fit for purpose. Thank you, Convener.
Jeremy Balfour to speak to Amendment 50 and other amendments in the group.
Thank you again, Convener. Amendment 50 requires Scottish ministers to establish an accreditation scheme to enable trained non-medical practitioners to supervise non-surgical procedures. It creates, I think, a clear and regulated pathway for suitably qualified and experienced practitioners who are not medically qualified to undertake supervisory roles within the new framework. The amendment does not seek to weaken safety standards or remove medical involvement. Instead, it ensures that supervision is based on proven competence and relevant experience. Under the amendment, accreditation would be delivered through a recognised professional body, providing structural assessment, external verification and ongoing professional development. The non-surgical sector includes many highly skilled practitioners who have completed extensive specialised training in aesthetic techniques and compliance management. Many years of experience and advanced qualifications directly related to the procedures being regulated. However, they may not hold a traditional medical qualification. As currently drafted, this bill risks limiting supervisory roles to only medically qualified individuals alone. That approach may not always reflect where expertise lies within the specified field. It could exclude experienced practitioners whose entire professional focus has been within aesthetics and who possesses detailed and practical knowledge of the procedures covered. The amendment has therefore been lodged to ensure that eligibility to supervise is based on training competence and recognised standards rather than a medical qualification title alone. Regulations should reflect the structure and realities of this sector it governs. A strict qualified base rule may not always be the most accurate measure of expertise in this context. There are also workforce considerations. Many businesses, particularly smaller ones in this sector, operate with lean staffing arrangements. If supervision is limited exclusively to medically qualified professions, there may be insufficient capacity in some areas, particularly within rural areas. This could increase costs and create practical difficulties in securing appropriate supervisory arrangements. By contrast, an accredited pathway for non-medical supervisors would widen the pool of eligible professionals while maintaining safeguards. It would preserve valuable expertise, support workforce stability and reduce increased costs arising from a limited supervisory cohort. If accepted, the amendment would create a clear and credible route to supervision. Practitioners, regulators and the public would have clarity about who is qualified to supervise and on what basis. Accreditation through recognised professional bodies would ensure accountability and ongoing standards. Patient safety would remain central, supported by defined criteria and regulatory oversight. In summary, Convener, Amendment 50 ensures that the supervisory model is robust, proportionate and aligned with the structure of the sector. maintain safety standards while recognising competence and supported workforce sustainability. Thank you.
Gillian Mackay to speak to Amendment 93 and other amendments in the group.
Thanks, Convener. The amendment requires Scottish Ministers to consult patient representatives, people with relevant clinical expertise and appropriate regulatory or enforcement bodies before making regulations under Section 5. Non-surgical procedures raise issues that span public health, clinical safety, consumer protection and enforcement. Consultation helps ensure that regulations are informed by lived experience and clinical insight and that they are practical to implement and enforce. For example, patient groups can highlight where risks are commonly misunderstood, clinicians can advise on anatomical and surgical considerations, and regulators and practitioners can ensure that requirements are workable in practice. This leads to better, more effective regulation and reduces the risk of unintended consequences.
Sandesh Gohani to speak to Amendment 94 and other amendments in the group.
Thank you. Listening to what has been said so far, I feel that my Amendment 94 seeks to simply give clarity about what supervision is and is not. And the point of my amendment is to ensure that there is clarity, and I do hope that my amendment would sort of ensure that both Jeremy Balfour and Gillian Mackay and others are going to be on the face of the bill in a way that makes it clear and obvious to everyone what it is that we mean.
Fulton McGregor to speak to Amendment 96 and other amendments in the group.
Thank you, Convener. Amendment 96 places a statutory duty on Scottish Ministers to lay draft regulations establishing minimum training and qualification standards for those providing non-surgical procedures within 3 years of the offence of operating outside permitted premises coming into force. Where Ministers consider this impractical, they must report to Parliament in explaining the reasons. The amendment responds directly to stakeholder and committee concerns about training standards, while recognises the constraints imposed by the UK Internal Market Act and the need for cooperation with the UK Government. The 3-year timetable provides a realistic and proportionate pathway for introducing standards, allowing time for regulatory development, cross-government engagement and for practitioners to adapt. Importantly, this approach provides a clear and transparent pathway forward. Practitioners will know what progress is expected within a defined timeframe, and that Parliament will be kept informed if there are challenges along the way. For those running small businesses, that certainly allows them to plan, to invest in training with confidence and to prepare for the change in a measured and responsible way. I want to put on record my thanks to the Minister and our team for her comments in the previous grouping and for working with me on this amendment. Thanks, Convener.
Thank you. Minister to speak to Amendment 35 and other amendments in the group.
Thank you, Convener. This group covers amendments which largely relate to Section 5 on the powers available to Ministers to make further provision about non-surgical procedures. I explained in my comments in previous groups why some matters need needed to be dealt with under delegated powers. Oh gosh, I was doing so well. Our use of delegated powers was of course considered by the DPLR committee, and I was grateful to Stuart McMillan joining us today for his chairing in that consideration. The committee recognised that some matters were appropriate for regulations, but did recommend that some additional safeguards were required in the exercising of this power. As such, the first amendment I wish to turn to in this group is Amendment 35 in my name, which requires the Scottish Ministers to consult in relation to all of the affirmative regulation-making powers in this bill. I hope all members will support this and agree that this is a proportionate approach to the issue identified by the DPLR committee. Amendments 54, 93 and 94 also provide consultation requirements, all specific to the power in Section 5. Amendments 93 and 94, lodged by Gillian Mackay and Sandesh Gohani, both require patient groups or those representing clients, clinical experts, regulators and enforcement bodies to be consulted. Dr Gohani adds representatives of the beauty and aesthetics industry to the list and makes other provision, which I will turn to shortly. Amendment 54 in Maurice Golden's name also includes consultation requirements, in this case with his local authorities, representatives of the industry and of training institutions. In respect of all of these consultation requirements, I would ask members to consider that the power in Section 5 of the Bill is capable of making very different sorts of provision. It is indeed capable of making substantial provisions, in which case not only would consultation be rightly expected, it would be required in order to fulfil the range of duties on Scottish ministers in relation to impact assessment. Amendment 35 in my name strengthens this requirement, and in those circumstances, some or all of the groups indicated may indeed be included in the list of consultees. But this power may also make quite small or technical changes, in which case targeted consultation would be more appropriate, and even more substantial matters may only be of interest to a subset of the groups named by members. Again, it would be a better use of time for the Scottish Government to consult with those bodies who have an interest in the matter at hand. For that reason, I urge the members not to press these amendments and to support the amendment in my name instead. I will now turn to Maurice Golden's Amendment 53, which does echo some of the concerns of this committee and which is unlikely to make the exercise of the regulation-making power in Section 5(1) of the Bill cumbersome. I do not consider this amendment to be necessary, as any government proposing regulations will consider their enforceability, and I would expect that the committee scrutinising regulations will seek assurance on this. However, I am happy to discuss further with the member at stage 3. On the other hand, I would urge Mr Golden not to press Amendment 55, which makes similar provision but also contains material which overlaps with a range of existing duties, including under the Equality Act, and which is likely to make the regulation-making power more cumbersome and less capable of being used in a reactive way. The next amendments I will consider are those that impose certain requirements on ministers in exercising these delegated powers or restrain the way they may be used. In this category, I include Amendments 48, 49, 52 and 90. These amendments include different approaches to requiring transitional protections and ensuring there are pathways for non-healthcare professional providers. The effect of Amendment 52 also means that no provision can be made about training or qualification requirements for persons providing non-surgical procedures. It does not provide alternative routes to demonstrate competence, and provisions around CPD, record keeping, audit incident reporting and complications management. These are not necessarily unreasonable matters to be considered, but putting these requirements against the whole exercise of the power would be cumbersome and perhaps disproportionate to enact. They would remove the discretion to deal with issues in the most appropriate way, whether in regulations under this power, using other regulations or in guidance. Amendment 45 is relatively technical, as it seeks to amend Section 5(2)(a) of the Bill to prevent regulations made under Section 5(1) from modifying Sections 2, 3, 4 and Schedule 1 of the Bill once it becomes an Act. Section 5(2)(a) as currently included in the Bill is not an unusual one, and it is required to provide flexibility in how new provision is written into legislation and how this can be made as readable as possible. For instance, amendments making specific requirements in relation to the settings for the provision of a particular procedure may do so in standalone regulations, which would then need to be read alongside the Bill provisions, or it may make sense to make modifications to Section 4 of the Bill to allow such matters to all be included in one place. For these reasons, the existing power in Section 5(2)(a) is considered necessary. Amendment 50 in Jeremy Balfour's name relates to creating a new regulatory scheme to facilitate certain categories of non-healthcare professionals to supervise procedures. This would be contrary to the strongly expressed views of consultees last year, who wished to see supervision restricted to certain healthcare professionals. It would also conflict with the reasoning I outlined in Group 3 around assurance of patient safety and dealing with complications. As such, I urge the member not to press this amendment. I said I would return to Amendment 94 in Sandesh Gulhani's name. Like his Amendment 97 in the last group, this amendment would require certain material to be published before regulations can be made. In this case, the requirement is to publish training standards. I can assure members that training standards are a priority, and it is a matter of great frustration to me personally that more progress has not been made here. I am, however, hopeful that members will shortly be approving my amendments on an individual assessment process that is a prerequisite to us resolving these issues. As I have said elsewhere, it is still going to be necessary for the Scottish Government to work with the UK Government on these matters. It is also likely to benefit practitioners if, where possible, requirements in Scotland and England are aligned. This means the timing of any standard of training is not entirely in the Scottish Government's gift. On this basis, the requirement Dr Gulhani has suggested here could prevent other matters being dealt with in a timely manner. On that basis, I would urge Dr Gulhani, again, not to press the amendment. Yes, of course.
My concern, Minister, is Amendment 35 in your name potentially allows future ministers to not consult with anyone as required and to make changes. And whilst there would be some very minor technical changes that probably wouldn't need a consultation, the concern is obviously that if it's a bigger change, that a consultation might be needed. So I suppose the most important thing is a further discussion, but any reassurances that could be given around that topic?
So I think what we have to ensure is that we get the right training and standards in place. I believe that Amendment 35 does that. However, I'm happy to continue that discussion, but I would suggest that people vote for Amendment 35 so we have that as the basis to continue discussions. The last amendment I wish to consider in this group also relates to training standards, and I'm grateful to Fulton McGregor for working with the Scottish Government on Amendment 96, which reflects the strength of concern around training issues and ensures that ministers do have to address this, but recognises our limited influence over timing. I hope members who have put forward amendments on training generally will also join me in supporting this amendment. Bringing my comments on this group to a close, I urge members to support Amendment 35 in my name, which I said training instead of consultation when I was responding to Dr Gulhani. My apologies. It delivers a proportionate consultation requirement and support Amendment 96 in Fulton McGregor's name, which recognises the importance of training standards being put in place. I urge members not to press the remaining amendments in this group. I should say my comments with regard to Dr Gulhani's point around consultation still stand.
Minister, Maurice Golden to wind up and press or withdraw Amendment 45.
Thank you, Convener. Nothing further to add, and I'd like to withdraw Amendment 45, please.
The member wishes to withdraw Amendment 45. Does any member object? No. There are no objections, so the amendment is withdrawn. I call Amendment 46 in the name of Maurice Golden, already debated with Amendment 77. Maurice Golden to move or not move?
Not moved.
Call Amendment 47 in the name of Maurice Golden, already debated with Amendment 77. Maurice Golden to move or not move?
Moved.
The question is that Amendment 47 be agreed to. Are we all agreed? No. Committee is not agreed and we'll move to a vote. Those in favour of Amendment 47? Those against? Abstentions? The result of the vote on Amendment 47 is 3 for, 7 against. There were no abstentions. Therefore, the amendment is not agreed. I call Amendment 48 in the name of Maurice Golden, already debated with Amendment 45. Maurice Golden to move or not move?
Moved.
The question is that Amendment 48 be agreed to. Are we all agreed? No. Committee is not agreed and we'll move to a vote. Those in favour of Amendment 48? Those against? Abstentions? result of the vote on Amendment 48 is 2 for, 8 against. There were no abstentions and the amendment is therefore not agreed. Call Amendment 49 in the name of Maurice Golden, already debated, with Amendment 45. Maurice Golden to move or not move?
Not moved.
I call Amendment 84 in the name of Stuart McMillan, already debated, with Amendment 77. Sorry. Stuart McMillan to move or not move?
Not move.
I call Amendment 87 in the name of Sandesh Gohani, already debated, with the Amendment 77. Sandesh Gohani to move or not move?
87 is consequential to 92. I don't intend to press 92, so not moved.
I call Amendment 50 in the name of Jeremy Balfour, already debated, with Amendment 45. Jeremy Balfour to move or not move?
Move.
The question is that Amendment 50 be agreed to. Are we all agreed?
No.
We'll move to a vote. Those in favour of Amendment 50? Those against? Abstentions? The result of the vote on Amendment 50 are there were 0 for the amendment, 10 against, no abstentions. Therefore, the amendment is not agreed. I call Amendment 51 in the name of Jeremy Balfour, already debated, with Amendment 76. Jeremy Balfour to move or not move?
No move.
Sorry, Mr Balfour.
Not
Not
move.
moved. Thank you. I call Amendment 88 in the name of Gillian Mackay, already debated, with Amendment 77. Gillian Mackay to move or not move?
Moved.
The question is that Amendment 88 be agreed to. Are we all agreed?
Yes.
Committee's agreed. I call Amendment 89 in the name of Gillian Mackay, already debated, with Amendment 77. Gillian Mackay to move or not move?
Moved.
The question is that Amendment 89 be agreed to. Are we all agreed?
Yes.
Committee's not agreed. We'll move to a vote. Those in favour of Amendment 89? Those against? Abstentions? The result of the vote on Amendment 89 is 8 for, 2 against. There were no abstentions. Therefore, the amendment is agreed. I call Amendment 52 in the name of Maurice Golden, already debated, with Amendment 45. Maurice Golden to move or not move?
Not moved.
I call Amendment 90 in the name of Maurice Golden, already debated, with Amendment 45. Maurice Golden to move or not move?
Not moved.
I call Amendment 91 in the name of Maurice Golden, already debated, with Amendment 77. Maurice Golden to move or not move?
Not moved.
I call Amendment 91 in the name of Sandesh Gohani. 92, sorry. I call Amendment 92 in the name of Sandesh Gohani, already debated, with Amendment 77. Sandesh Gohani to move or not move?
Given what the Minister said, I do feel that we need to have a further discussion about it, but for this moment I will not move.
Thank you. I call Amendment 26 in the name of Gillian Mackay, grouped with Amendments 56, 102, 57, 27 and 104. Gillian Mackay to move Amendment 26 and to speak to all amendments in the group.
Thanks, Convener. I want to thank the Minister for her support and engagement on this amendment. Amendments 26 and 27 in my name increase the penalty that could be imposed on a person who is found guilty of an offence under the bill. Section 5(4) of the bill sets out the maximum penalty that may be provided for in regulations under subsection 5(1) for a person who commits an offence created by regulations made under the section on summary conviction, a fine not exceeding level 5 on the standard scale. Amendment 26 amends Section 5 and allows for a higher level of penalty by increasing the maximum level of fine for offences that may be provided for by offences created under regulations. And Section 12 of the bill sets out that a person who commits an offence under Section 2, 3 or 11 is liable on summary conviction to a fine not exceeding level 5 on the standard scale, currently a maximum of £5,000. Amendment 27 amends Section 12 and allows for a higher level of penalty by increasing the maximum level of fine for the offences in the bill in Sections 2, 3 or 11. In each of these offences will now be triable either by summary procedure or an indictment, and the amendments increase the maximum allowable fine for offences to £20,000 on summary conviction and the fine allowable on conviction on indictment to an unlimited fine. Yes.
Thank you. I wonder if you would be open to looking at having a sliding scale, so everyone can make a mistake on their first fine, but certainly if it's repetitive behaviour where people are using this as just the cost of doing business, then you would want to see the maximum fines introduced.
I think Dr Gulhani will appreciate that any fine in any case will be for the judge that's in charge at that point, so they may decide that a lower fine for a first offence may be applicable and probably shouldn't be on the face of the bill with us deciding that. And that's the end of my remarks, Convener.
Very much, Ms Mackay. Maurice Golden to speak to amendment. Oh, sorry, can I ask you to move the amendment?
Moved.
Maurice Golden to speak to amendment 56 and other amendments in the group.
Thank you, Convener. Amendment 56 in my name is to ensure proportionate, transparent, fair and focused on public safety with regard to HIS inspection and enforcement of non-surgical procedures. And 57 is designed to provide safeguards on governance and accountability. Thank you, Convener.
Philip McGregor to speak to amendment 102 and other amendments in the group.
Thanks, Convener. Amendment 102 requires Healthcare Improvement Scotland to ensure that enforcement powers are applied in a way that is proportionate to both the size of the provider and the risk profile of the services delivered. While robust regulation is essential for public safety, this amendment seeks to ensure that enforcement action, including fines, is fair, proportionate and targeted at genuine risks and serious non-compliance, avoiding unintended and disproportionate impacts on small providers for minor breaches. As I mentioned earlier, this is a sector predominantly made up of self-employed practitioners, many of whom are young working-class women. We must ensure that those who wish to set up their own businesses and contribute to Scotland's economy aren't put off by disproportionate penalties. I and those in the industry robustly reiterate the need for safety first. So this amendment simply asks for the enforcement to be proportional and not lax. This amendment is intended as a probing amendment, and I'm clearly interested in what the Minister's thoughts are at this stage. Thanks, Convener.
Thank you. Sandesh Gulhani to speak to amendment 104 and other amendments in the group.
Thank you. I feel that 104 seems a rather sensible amendment, because what I'm looking at is within a year of the bill coming into force, I would like ministers to review how the enforcement provisions are working in practice. So that looks at the number of fines, whether multiple fines are being issued to the same practitioner, looking to see whether enforcement powers are providing enough of a deterrent and whether the level of fine should be modified as a result of this. So an example would be if repetitive behaviours incurring the maximum fine keep occurring, because it seems to be within their interest to do so. So for me, it's a sensible amendment looking to see if we've got things right when it comes to fines.
Minister.
Thank you, Convener. I would like to thank Ms Mackay for lodging amendments 26 and 27. I'm aware that concerns have been expressed about the level of penalties in the bill as introduced, and I thank the committee for their comments in their Stage 1 report. It is vital that the bill has teeth and sets penalties that act as a meaningful deterrent to any practitioners who choose not to engage with the new regulatory scheme. Having listened to the committee, I appreciate that the level of penalty set in the bill is not a sufficient deterrent for businesses which could be earning up to £5,000 per day. Amendments 26 and 27 allow the offences in the bill to be triable either under summary procedure or indictment. The penalty which can be imposed by the court will be a maximum fine of £20,000 on summary conviction or an unlimited fine on conviction on indictment. As with any offence which is triable, either under summary procedure or indictment, it will be for prosecutors to decide upon the appropriate procedure based on the evidence provided to them. This represents a significant increase in the level of penalty which may be imposed, particularly in cases where more than one offence is committed. For example, providing a non-surgical procedure to a person under the age of 18 and out with a permitted premises, or where repeat offences occur. In addition, whether an offence is committed under the bill or not, a person could still commit other offences if they cause harm, depending on the facts and circumstances of the case, and these would carry their own penalty. I urge members to support Amendments 26 and 27. Whilst I recognise Mr Golden's Amendments 56 and 57, and Mr McGregor's Amendment 102 seeks proportionality, transparency, good governance and accountabilities, these duplicate existing requirements on HIS and are therefore not required on the face of this bill. In respect of Amendment 56, HIS inspections are based on publicly available standards and inspection reports are published by HIS for transparency purposes. HIS also have a complaints procedure should providers not feel inspection reports are fair or accurate. In respect of Amendment 57, HIS are required to comply with data protection legislation in relation to client information they may obtain as part of their inspection processes. HIS also takes an improvement approach, first that supports those they are inspecting to improve their services before taking other action. Mr McGregor's Amendment 102, similar to Amendment 56, seeks for proportionate enforcement. The Scottish Government is not aware of HIS using their enforcement powers in a disproportionate way. However, if Mr McGregor or anyone else is aware of concerns, I would ask you to raise them with me directly. If it is regarding proportionate penalties, then there is discretion that the courts or prosecutors can use. Dr Gulhani's Amendment 104 seeks a useful and insightful review, and whilst I again support the intention behind it, would consider these asks consider that these asks could perhaps perform part of a wider review provision, and which we will come on to when discussing the group entitled Review of Part 1. I would ask members not to press these amendments.
Thank you, Minister. Gillian Mackay to wind up and press or withdraw Amendment 26.
Nothing further to add, Convener, and I'll press Amendment 26.
The question is that Amendment 26 be agreed to. Are we all agreed? Yes. I call Amendment 53 in the name of Maurice Golden, already debated, with Amendment 45. Maurice Golden to move or not move?
Not move.
I call Amendment 54 in the name of Maurice Golden, already debated, with Amendment 45. Maurice Golden to move or not move?
Not moved.
Call Amendment 93 in the name of Gillian Mackay, already debated, with Amendment 45. Gillian Mackay to move or not move?
Not moved.
Call Amendment 94 in the name of Sandesh Gohani, already debated, with Amendment 45. Sandesh Gohani to move or not move?
I think given what has been said already, again, this is one of those amendments that I do think is important, and we do need to have further discussions about it, but I will not move.
I call Amendment 95 in the name of Sandesh Gohani, already debated, with Amendment 77. Sandesh Gohani to move or not move?
Not moved.
I call Amendment 96 in the name of Fulton McGregor, already debated, with Amendment 45. Fulton McGregor to move or not move?
Moved.
The question is that Amendment 96 be agreed to. Are we all agreed? No. Committee is not agreed. We'll move to a vote. Those in favour of Amendment 96? Those against? Abstentions? The result of the vote on Amendment 96 is 8 for, 2 against. There were no abstentions. The amendment is therefore agreed. The question is that Section 5 be agreed to. Are we all agreed? Yes. Call Amendment 55 in the name of Maurice Golden, already debated, with Amendment 45. Maurice Golden to move or not move?
Not moved.
I call Amendment 97 in the name of Sandesh Gohani, already debated, with Amendment 77. Sandesh Gohani to move or not move?
Moved.
The question is that Amendment 97 be agreed to. Are we all agreed? No. Committee is not agreed and we will move to a vote. Those in favour of Amendment 97? Those against? Abstentions? The result of the vote on Amendment 97 is 4 for, 5 against and 1 abstention. Therefore, the amendment is not agreed. I call Amendment 98 in the name of Gillian Mackay, already debated, with Amendment 77. Gillian Mackay to move or not move?
Not moved.
I call Amendment 99 in the name of Sandesh Gohani, already debated, with Amendment 77. Sandesh Gohani to move or not move?
Not moved.
I call Amendment 100 in the name of Maurice Golden, already debated, with Amendment 75. Maurice Golden to move or not move?
Not moved.
The question is that Section 6 be agreed to. Are we all agreed? Yes. I call Amendment 56 in the name of Maurice Golden, already debated, with Amendment 26. Maurice Golden to move or not move?
Moved.
The question is that Amendment 56 be agreed to. Are we all agreed? No. Committee is not agreed and we will move to a vote. Those in favour of Amendment 56? Those against? Abstentions? The result of the vote on Amendment 56 is 2 for, 8 against. There were no abstentions and the amendment is therefore not agreed. Call Amendment 102 in the name of Fulton McGregor, already debated, with Amendment 26. Fulton McGregor to move or not move?
Not moved.
I call Amendment 57 in the name of Maurice Golden, already debated, with Amendment 26. Maurice Golden to move or not move?
Moved.
The question is that Amendment 57 be agreed to. Are we all agreed? Committee is not agreed and we will move to a vote. Those in favour of Amendment 57? Those against? Abstentions? The result of the vote on Amendment 57 is 4-3 against 7. There were no abstentions and therefore the amendment is not agreed. The question is that Sections 7, 8, 9, 10 and 11 be agreed to. Are we all agreed? Call Amendment 103 in the name of Sandesh Gohani, already debated, with Amendment 77. Sandesh Gohani to move or not move?
Again, for further discussion with the Minister, so not moved.
Call Amendment 27 in the name of Gillian Mackay, already debated, with Amendment 26. Gillian Mackay to move or not move?
Moved.
The question is that Amendment 27 be agreed to. Are we all agreed? Yes. Committee's agreed. The question is that Section 12 be agreed to. Are we all agreed? Yes. The question is that Section 13 be agreed to. Are we all agreed? Yes. I call Amendment 104 in the name of Sandesh Gohani, already debated, with Amendment 26. Sandesh Gohani, to move or not move?
Difficult one, because the Minister said that she will be coming on to discuss this prior to the vote being taken. So given that I don't know what the Minister is going to say, I'm going to move.
The question is that Amendment 104 be agreed to. Are we all agreed? No. Committee is not agreed, and we'll move to a vote. Those in favour of Amendment 104? Those against? Abstentions? The result of the vote on Amendment 104 is 4 for, 6 against. There were no abstentions. The amendment is therefore not agreed. I call Amendment 28 in the name of the Minister, already debated, with Amendment 5. Minister, to move formally.
Moved.
The question is that Amendment 28 be agreed to. Are we all agreed? Call Amendment 105 in the name of Sandesh Gohani. Oh, I can't, so apologies, I can't call that. We would have moved to Amendment 105 that we've already debated, but we're unable to put that to a vote in the absence of a financial resolution. I call Amendment 106 in the name of Sandesh Gohani, already debated, with Amendment 75. Sandesh Gohani, to move or not move?
Not moved.
The question is that Section 14 be agreed to. Are we all agreed? Yes. I call Amendment 29 in the name of the Minister, group with Amendments 32 and 33. Minister, to move Amendment 29 and to speak to all amendments in the group.
Thank you, Convener. Amendment 29 is a consequential amendment to reflect Healthcare Improvement Scotland's extended role under Part 1 of the Bill in relation to non-surgical procedures. It will add reference to Part 1 of the Bill to Sections 76 and 77 of the National Health Service Scotland Act 1978, so that inquiries can be held in relation to any matters arising under Part 1 of the Bill, and orders can be made after any such inquiry in relation to any default by Healthcare Improvement Scotland in carrying out their functions in relation to non-surgical procedures. These powers are a last resort, but it is appropriate that any gap created where HIS acquires new functions is filled in a manner consistent with the approach taken where these powers were first included. Section 17 of the Bill amends Section 18 of the Certification of Death Scotland Act 2011 so that medical reviewers need to authorise cremation where deaths take place out with the United Kingdom. Amendment 32 makes a consequential amendment to Section 14(1)(b) of the 2011 Act in consequence of the change to Section 18 of that Act that is to be made by Section 17 of the Bill. The Hydrolysis Scotland No. 1 Regulations 2026 were passed by a vote in this Parliament on the 21st of January 2026. The hydrolysis regulations ensure that medical reviewers will have the power to authorise hydrolysis in the same way they authorise cremation, and the regulations change the title of Section 18 of the 2011 Act. Amendment 33 amends the cross-reference to the title of Section 18 in consequence of the hydrolysis regulations. I move Amendment 29.
Thank you, Minister. No other member has asked to speak in this part of the debate. Is there anything further that you wish to add, Minister?
That I urge members to support Amendments 29, 32 and 33.
Thank you. The question is that Amendment 29 be agreed to. Are we all agreed? Yes. The question is that Schedule 2 be agreed to. Are we all agreed? Yes. I call Amendment 58 in the name of Maurice Golden, already debated, with Amendment 77. Maurice Golden, to move or not move?
Not moved.
I call Amendment 30 in the name of the Minister, already debated, with Amendment 5. Minister, to move formally.
Formally moved.
The question is that Amendment 30 be agreed to. Are we all agreed? Yes. I call Amendment 31 in the name of the Minister, already debated, with Amendment 9. Minister, to move formally.
Moved.
The question is that Amendment 31 be agreed to. Are we all agreed? The question is that Section 15 be agreed to. Are we all agreed? I call Amendment 59 in the name of Maurice Golden, group with Amendments 107, 108, 109 and 111. Maurice Golden to move Amendment 59 and to speak to all amendments in the group.
Thank you, Convener. And Amendment 59 requires transparent evaluation of whether the regulatory approach improves safety without disproportionate impact on access, business viability, workforce and enforcement capacity. And I think alongside, I would hope, helps to improve data capture and therefore inform future regulatory practice and ultimately improve safety. Thank you, Convener.
Thank you. Stuart McMillan to speak to Amendment 107 and other amendments in the group.
Thank you, Convener. I think one of the aspects of the Parliament that the Parliament really has kind of let itself down on over the years is the lack of post-legislative scrutiny. And it's a point that's been raised time and time again. So the purpose of this Amendment 107, it is more of a kind of probing amendment, to be fair, but it's just to ensure that if it were to be accepted, that there would be actually some type of review at some point in the future. Now, the 5 years is an arbitrary figure, so it's clearly not set in stone. But I think because of how the legislation has been drafted, with so much of the details to come in regulations afterwards, that was one of the reasons why I went for the 5 year, because of that continual flexibility for the bill to be, well, for any legislation to be constantly updated over that period. So that flexibility is hugely important. Now, obviously, I do chair the Delegated Personal Law Reform Committee, and continually when bills do come forward to that committee, if it's considered to be more of a, to use the term, the framework legislation as compared to something with a lot of detail on the face of the bill, the committee at times has been quite challenging to the government. But this particular legislation is actually really helpful in that regard, because this is such a fast-moving industry. That flexibility is hugely important. So I thought go for the 5 years, because it still does provide that opportunity for Parliament to look at a constantly evolving industry and to see basically if there are any particular additional tweaks or changes that are required. Thank you.
Thank you, Mr McMillan. Sandish Gulhani to speak to Amendment 108 and other amendments in the group.
I tend to agree with Stuart McMillan in the fact that we don't do post-legislative scrutiny particularly well, and so the point of my Amendment 108 is very similar, because it's looking to see what impact has on businesses. Again, much like Stuart McMillan choosing 5 years, I chose a year. It's very much one that I'm happy to negotiate. It's just an arbitrary figure so that we have an amendment so that we actually get some post-legislation scrutiny.
Carol Mochen to speak to Amendment 109 and other amendments in the group.
Thank you, Convener. So this amendment would require the Government to carry out a review of the bill's impact of the NHS workforce. And it arose from concerns about the impact the bill could have on the NHS if workers trained specifically and are pulled into the private sector. It's really more a probing amendment to put on the record Scottish Labour's concern about the impact the bill could have on the NHS workforce, given the amount of pressure it's already under. Of course.
I'm really grateful to the member. I think I know exactly where you're trying to go with this, but would you not agree that this is already happening? That we're losing nursing staff to aesthetics as it currently stands, and that's a trend that is really worrying.
Thank you. I thank the member for that intervention. I think, yes, it is something that we've been thinking about, and so I think this amendment is just to probe, does the government take it seriously because of the pressures that we know are already there in the workforce. I suppose this amendment, as I say, is more probing, just to hear from the Minister what they can or will do to just make sure that we have a workforce for the NHS if this legislation goes through that doesn't disrupt that. Of course.
at risk of battering from this side of the table, I am just a little bit concerned about whether individuals choose to take on a course simply to then be allowed to go into aesthetics rather than take the course to actually do. So dental nursing is the example I give, where people might do that simply to be able to practice rather than to do dental nursing, of which we are desperate for dental nurses. I wonder if you might agree with that.
Yeah, thank you, Dr Gohani. We have discussed this, and I think it is about how, as a government, we make sure that we are getting the right person in the right place at the right time for whatever profession they choose, but that we have that backup, we knowledge that we have the right staff in for our public services. So thank you for the members for the interventions, much appreciated. Thank you.
Paul Sweeney to speak to Amendment 111 in the name of Davy Russell and other amendments in the group.
Thank you, Convener. And I speak to Amendment 111 in the name of Mr Russell. He sends his apologies. He's at a funeral for a friend and can't attend today. This amendment is supposed to call the government to evaluate whether the bill has accomplished what it is set out to do. On review of the amendments, Mr Russell believes that this can be broadly accomplished by Amendment 59 in the name of Maurice Golden and Amendment 109 in the name of Carol Mochan, and so would like to add his support to those amendments. The only outstanding issue is that on production of these evaluations, one on whether non-surgical cosmetic procedures have become safer and one on whether there has been an adverse effect on the NHS workforce, Mr Russell would like the Scottish Government to be compelled to bring a motion of repeal of the bill within 12 months of the publishing of both of those reports, in other words, after the later of the two reports has been published. And it would be seeking assurances that this is something that the Scottish Government could commit to putting on the face of the bill.
Thank you, Mr Sweeney. Minister.
Thank you. This group of amendments reflects a range of different concerns. I am aware that not all members intend to press amendments in this group, and I'm grateful for the constructive comments we've had so far. I would strongly resist, in the interests of safety and on the grounds of certainty and continuity for business, Amendment 111, because it makes provision about the expiry of Part 1. But it is reasonable that the Scottish Government be held to account on the effectiveness of this part of the bill, which will no doubt continue to be of interest in the next Parliament. Turning to the remaining amendments, 59, 107, 108 and 109, if all were pressed and all were successful, this would add a significant pressure on government and parliamentary time. If none of these amendments are pressed, the successor to this committee could open a programme of work reviewing any or all matters in relation to this bill. This could be done at a time of the committee's choosing, and the committee could take evidence from the Scottish Government and any other bodies it saw fit. However, given the strength of interest in a statutory review led by the Scottish Government, it seems appropriate that a review should be undertaken that is sufficiently broad in scope and at a time that allows a full consideration of the operation of Part 1 of the bill. Amendment 109 in Carol Mochan's name raises an important issue, and I appreciate our meeting regarding this, but it appears too narrow given the other interests which are appropriate here. 59 and 108 are both broader, but I consider that in each case the specification currently offered is likely to make a report more cumbersome and less able to address the issues that emerge. I believe they also require a report at a stage which is too easy or too early for the impacts, positive or other, of this bill to have fully emerged. On the other hand, Stuart Macmillan's Amendment 107 is sufficiently broad to allow all issues raised by members to be considered and operates on a reasonable timescale so that consideration can be as full as I'm sure members would expect. On this basis, I recommend that members support Amendment 107. I would be happy to discuss with members any other issues that they feel strongly need to be considered as part of the review, and I'm happy to work with Mr Macmillan and other members with a view to working together on Stage 3 amendments to the new section introduced by Mr Macmillan's amendment.
Thank you. 5 years would put us at this stage at the next Parliament, so a review would be during an election period. So I wonder if well, for further discussion, but at 4 years, so that it wouldn't be sort of right at the end of a parliament.
So if I may, and I will check this, and this is exactly the conversations I think we need to have. If you said 1, Stuart McMillan said 5, so do we go in the middle 3? With regards to, I'm happy to negotiate. With regards to when the review would take place, it would be 5 years after the bill comes into action, so that would be in the next system, the next parliamentary session.
Thank you, Convener. Certainly also the amendment that I did put forward, it did say 5 years of Section 3 coming into force. So it wouldn't be within an election period, it certainly would be afterwards.
Minister, have you concluded your remarks?
I've concluded, yes, sorry,
Thank
apologies.
You. No, that's fine. Maurice Golden to wind up and press or withdraw Amendment 59.
Thank you, Convener, and happy to press.
Question is that Amendment 59 be agreed to. Are we agreed? No. Committee is not agreed and we'll move to a vote. Those in favour of Amendment 59? Those against? Abstentions? The result of the vote on Amendment 59 is 4 for, 6 against. There were no abstentions, therefore the amendment is not agreed. I call Amendment 107 in the name of Stuart McMillan, already debated, with Amendment 59. Stuart McMillan to move or not move?
Move.
The question is that Amendment 107 be agreed to. Are we all agreed? Yes. We are agreed. I call Amendment 108 in the name of Sanders Kohani, already debated, with Amendment 59. Sanders Kohani to move or not move?
Not moved.
I call Amendment 109 in the name of Carol Mochan, already debated, with Amendment 59. Carol Mochan to move or not move?
Not moved.
I call Amendment 110 in the name of Carol Mochan, already debated, with Amendment 76. Carol Mochan to move or not move?
Not moved.
I call Amendment 111 in the name of Davy Russell, already debated, with Amendment 59. Paul Sweeney to move or not move?
Not moved.
The question is that Section 16 be agreed to. Are we all agreed?
Yes.
I call Amendment 32 in the name of the Minister, already debated, with Amendment 29. Minister to move formally.
Formally moved.
The question is that Amendment 32 be agreed to. Are we all agreed?
Yes.
I call Amendment 33 in the name of the Minister, already debated, with Amendment 29. Minister to move formally.
Moved.
The question is that Amendment 33 be agreed to. Are we all agreed?
Yes.
The question is that Section 17 be agreed to. Are we all agreed? Yes. The question is that Section 18 be agreed to. Are we all agreed? I call Amendment 4 in the name of Claire Hockey, already debated, with Amendment 1, and I move the amendment. The question is that Amendment 4 be agreed to. Are we all agreed? Yes. I call Amendment 112 in the name of Stuart McMillan, already debated, with Amendment 9. Stuart McMillan to move or not move?
Not moved.
Call Amendment 113 in the name of Maurice Golden, already debated, with Amendment 9. Maurice Golden to move or not move?
Not moved.
Call Amendment 60 in the name of Maurice Golden, already debated, with Amendment 9. Maurice Golden to move or not move?
Not moved.
I call Amendment 61 in the name of Maurice Golden, already debated, with Amendment 9. Maurice Golden to move or not move?
Not moved.
Call Amendment 115 in the name of Fulton McGregor, already debated, with Amendment 77. Emma Harper to move or not move?
Not moving.
Call Amendment 117 in the name of Sanders Kohani, already debated, with Amendment 76. Sanders Kohani to move or not move?
Not moved.
Call Amendment 118 in the name of Sandesh Gohani, already debated, with Amendment 75. Sandesh Gohani to move or not move?
Not moved.
Call Amendment 34 in the name of the Minister, already debated, with Amendment 5. Minister to move formally?
Moved.
The question is that Amendment 34 be agreed to. Are we all agreed? The question is that Section 19 be agreed to. Are we all agreed? Call Amendment 35 in the name of the Minister, already debated, with Amendment 45. Minister to move formally?
Moved.
The question is that Amendment 35 be agreed to. Are we all agreed? The committee is not agreed, and we'll move to a vote. Those in favour of Amendment 35? Those against? Abstentions? The result of the vote on Amendment 35 is 8-4, 0 against. There were 2 abstentions and the amendment is agreed. Call Amendment 119 in the name of Sandesh Gohani, already debated, with Amendment 76. Sandesh Gohani to move or not move?
Moved.
I call Amendment 62 in the name of Jeremy Balfour Group, with Amendments 63 and 121. Jeremy Balfour to move Amendment 62 and speak to all amendments in the group.
Thank you, Convener. Amendment 62 clarifies that the power to bring relevant sections of a bill into force is subject to a proposed 18-month delay. This will ensure that the commencement provisions are fully aligned with the intended transition period and removes any uncertainty for business about timing. Where legislation includes both a general commencement power or a specified delay, it is important that the relationship between the two is clearly stated and, perhaps more importantly, fully understood by all. Without the clarity, there is a risk of confusion or different interpretations. This amendment has been lodged to ensure that the 18-month delay cannot be shortened inadvertently through the use of commencement powers. It strengthens the drafting of the bill by making the intended timescale explicit, and if agreed, the amendment would provide clarity and reassurance to business, practitioners and regulators about when the new regime will take effect. It supports a planned and orderly transition. Although, if it is not accepted, there may remain some uncertainty about how the commencement powers interact with the delay. Even if there is no intention to alter the timescale, lack of clarity in drafting can create avoidable ambiguity. In summary, Amendment 62 provides necessary clarity and certainty around the timing of implementation. It ensures that intended 18-month transition period cannot be altered and the commencement provisions operate exactly as Parliament expects. By aligning the drafting of a bill with the stated timetable, the amendment promotes transparency, avoids ambiguity and supports a stable and orderly introduction to the new regime. Finally, Amendment 63 provides that sections 1 to 14 of the bill may not come into force until 18 months after royal assent. It establishes a clear and defined transition period before the main regulatory provisions take effect. The bill introduced substantial changes to how non-surgical procedures are supervised and regulated. Businesses do need and will need time to understand the new requirements, review their arrangements and undertake any necessary training, formalise supervision agreements and adapt their operating models. Many providers, as has been said on numerous occasions, are small businesses with limited admin capacity. Compliance may involve securing new premises, updating insurance arrangements, revising contracts and introducing new record-keeping systems. These changes require planning and cannot be implemented immediately, certainly not overnight, without the risk of disruption. This is particularly true for those who are sole practitioners. Similarly, regulators will also require time to prepare guidance, develop registration systems, recruit and train staff, and establish inspection processes. Effective regulation depends not only on policy design, but actually on practical readiness. This amendment ensures that reform is introduced to a realistic and carefully managed way. An 18-month transition period provides certainty and allows both businesses and regulators to prepare properly. If agreed, the amendment would support orderly implementation and reduce the risk of rushed compliance, administrative backlogs or unintended closures. It increases the likelihood that new regime will operate effectively from the outset. I believe if not agreed, commencement could occur sooner, placing undue pressure on business and regulators to meet new requirements within a shorter time frame. This may increase the risk of operational strain or disruption and, sadly, some businesses going out of business. In summary, Amendment 63 ensures that reform is delivered responsibly. It does not delay change unnecessarily, but ensures that when the new regime comes into force, it does so on a stable and well-prepared basis. I thus move Amendment 62 in my name.
Thank you, Mr Balfour. Paul Sweeney to speak to Amendment 121 in the name of Davy Russell.
Thank you, Convener. Speaking in this Amendment 121 in the name of Mr Russell. This is a delay clause very similar to Amendment 63 in the name of Jeremy Balfour, with the exception of the period of delay. The argument for a period of 3 years is that in the event that some other amendments to the bill don't pass, then this will allow current practitioners to seek clarity on training requirements and make arrangements to either qualify as registered prescribers themselves, have an existing trained member of staff qualify as a prescriber, or make provisions to hire a registered prescriber. Such a time frame could also mean that price increases caused by the bill could be made in a gradual way and avoid pulling the rug out beneath practitioners. The 3-year delay is about balancing the safety of this bill with the time it takes to qualify as a prescriber. Mr Russell also notes that a concern for current practitioners is that if the bill passes without sufficient amendment, that non-medical practitioners cannot possibly still function in this sector, then a longer lead-out time to allow them to close rental and other contractual agreements, such as with medical waste management, would be beneficial to them, and so would support the 18-month period proposed by Mr Balfour's amendment as an absolute minimum.
Thank you, Mr Sweeney. Minister.
Thank you, Convener. I have previously indicated my intention to commence the key provisions of this bill in September 2027 to align with the Civic Government Act 1982, Licensing of Non-Surgical Procedures Order 2026. I have already made it clear that I do not intend to bring key sections of this bill into force until September 2027. Amendments 62 and 63 in Mr Balfour's name would imply a similar but not identical timeline, delaying commencement by a few months, depending on the date of royal assent. In practice, this would imply that key provisions, including offences, would come into force in early 2028. I am concerned that the current drafting of this amendment would not only delay the commencement of offences, but also prevent us from progressing any regulations under the bill. Of course.
I'm obliged to the Minister. I suppose a couple of thoughts from you in regard to this. Firstly, we don't want to prejudge the next election. I appreciate you have given this guarantee, but there could be a different government, there could be a different minister who had a different view. So to have something within the bill itself or the Act perhaps would give clarity in case there is a change of government or there's a different form of government. And secondly, 18 months, I suppose, was an opening gambit, and like yourself, I'm open to negotiation. Would the Minister be willing to some kind of amendment to bring it into force to what she's planning to do anyway, which would be September 27? If we were looking at that type of amendment, would she be open to that?
I'll continue with my notes because I address that point that Mr Balfour has just made. This would, if I go back, I'm concerned that delaying would mean that it's not possible for us to progress work on a Section 26 scheme and training standards in advance of the main provisions coming into force. I am of the view that bringing in regulations early is better for businesses and enforcement agencies, even if those amendments can only come into force at the same time as the offences. I would be happy to work with Jeremy Balfour on an alternative approach that could be brought forward at stage 3 to give businesses clarity about what they will need to meet the requirement of the bill, and in return I ask the member not to press Amendments 63 and 64. Turning to Amendment 121 in Mr Russell's name, I cannot support as long a delay as he suggests. This would prevent us from taking essential steps to improve safety in this sector for too long, and I do not believe that meets the public concern on this matter, and I hope other members will agree. I urge that this amendment not be pressed.
Thank you, Minister. Jeremy Balfour, to wind up and press or withdraw Amendment 62.
In the light of the Minister's remarks, I seek to withdraw the amendment. Convener.
The member seeks to withdraw the amendment, Amendment 62. Does any member object to the amendment being withdrawn? No. There are no objections, so the amendment is withdrawn. I call Amendment 63 in the name of Jeremy Balfour, already debated with Amendment 62. Jeremy Balfour, to move or not move?
Not move, Convener.
I call Amendment 120 in the name of Sandesh Gohani, already debated with Amendment 77. Sandesh Gohani, to move or not move?
Not moved.
I call Amendment 121 in the name of Davy Russell, already debated with Amendment 62. Paul Sweeney, to move or not move?
Not moved.
The question is that Section 20 be agreed to. Are we all agreed? Yes. The question is that Section 21 be agreed to. Are we all agreed? Yes. The question is that the long title be agreed to. Are we all agreed? Yes. And that ends Stage 2 consideration of the bill. At the next meeting, we will take oral evidence from selected stakeholders on sport and physical activity, and that concludes our meeting today.